All right, y'all. Let's start finding a place to sit. We got a long day.
Patrick's finally here. We can get started.
Tillery finally made it, so Chairman Tillery's here, so we can start now.
You brought my coffee, right?
I forgot your coffee. Sorry. I'm sure if somebody, Chairman Tillery would like a cup of coffee.
No, I don't. No.
Do you like sugar and cream?
Actually, I don't. That's
All
my
right.
only healthy thing I do is don't put sugar in my coffee.
Well, good morning. We do have a long day. I'll start today off, and I'll ask Representative Tarvin if he will open us with prayer. Hit your button there.
Is that good enough?
Yes, sir.
Shall we pray? Heavenly Father, we look to you this morning as we open up and look at our budget and schedules for this year and look to what's best for the state of Georgia. We ask that you would lead, guide, and direct us in all that we do, and it would be pleasing before you. In Jesus Christ's name we pray. Amen.
Thank you. Just a couple of kind of, I'm not going to say ground rules, but some observations from yesterday. We were not able to get all of the questions, and today we're probably not going to be able to get all the questions today that you have of our presenters. But those of you who like to give a dissertation before you ever even ask your question, it would be nice if you just ask your question. So I'm being serious, because a lot of times the questions are longer than the answer. So please try to make your questions succinct and to the point. So with that being said, are you ready to kick off our long day of presentations? We'll welcome Commissioner Candace Brost, the Commissioner of Department of Human Services. Good morning. Oh, we got to get you turned on, sorry.
Can everyone hear me? Okay. There we go.
The floor is yours.
Thank you. Let me get situated. All right. All right, Mr. Chairman, members of the committee, legislators in attendance today. I'm Candace Brost. I'm the DFACS Director and the Department of Human Services Commissioner. The department has three main divisions: Aging Services, Child Support Services, and Family and Children Services, with a little over 9,300 employees, over 230 offices, and the overarching mission of Stronger Families for a Stronger Georgia. And we have just a few slides to highlight the governor's recommendations for AFY 24 and FY 25. But I'll start off with an agency overview with a side-by-side. If you'll go to slide 2, starting with this comparison of AFY 24 and FY 25 with recommendations for statewide adjustments, workload adjustments, and totals, including our attached agencies. You can see under AFY 24 for statewide adjustments, an increase of $10,334,410, which translates to the governor's $1,000 bonus for state employees right before the new year. For AFY 24 workload adjustments, there's $8,129,590. For FY 25 statewide adjustments, there's a little over $15 million to reflect the governor's cost of living increase for our workforce. And you'll see higher merit system billings, higher rates for Georgia Technology Authority technology services, increased insurance premiums through DOAS programs, and reductions to reflect a higher drawdown in federal funds, essentially increased FMAP. So you'll see those across multiple program budgets, and I won't hit on every single one, just touching on those at the outset. As for FY 25 workload adjustments, there's $9,420,534. And again, I'll just be focusing in the remainder of my remarks on program-specific changes, since those are common across multiple program budgets throughout. So going to slide 3 for AFY 24, starting with Child Welfare Services, and I'm using the page 218, recommended change 2, with $3,167,659 for technology upgrades and improvements to the Shines Child Welfare Case Management System. Shines is the system that DFACS uses for child welfare case management, for child protective services, foster care, family support, and family preservation, and that underlying technology is nearly 2 decades old. Ultimately, the system needs to be replaced soon, but in the interim, we must maintain its current level of functionality. So with this funding, we can keep Shines secure, and we can make adjustments as needed based on changes to law, rules, policy, and practice. On the next recommended change, in your sheet, or on your sheet, number 3, same page, you'll see $214,146 to cover the full cost of 2 community action team pilot programs originally funded in 2022. And I'll get into more detail on those programs when I cover recommendations for FY25. The next area with program-specific adjustments is departmental administration, page 219, starting with recommended change 2, with a transfer of $590,000 from elder abuse investigations and prevention, which captures savings from disregards, combined with a $910,530 increase to cover higher than expected costs for mail notices, which stems from the ongoing Medicaid redetermination process. So thus, we've got a total increase of $1,500,530. And on the next recommended change 3, with $1,732,568 to integrate Georgia Pathways and Georgia Access, which are the 2 waiver programs spearheaded by the governor's office, integrating those programs into Georgia Gateway, which is the state's integrated eligibility system where we administer Medicaid, SNAP, TANF, and other programs across the state. On the very next recommended change, number 4, there's a $2,636,268 reduction. That reflects savings from office space consolidation. We went from 2 Peachtree with 17 floors to 2 at 47 Trinity, and we're going to leverage county offices. Again, we have 233 offices statewide. As previously stated in the departmental administration program budget, there's a transfer of $590,000 to align the budget with expenditures. And that should cover this slide. If you'll go to the next one, please. Moving to federal eligibility benefit services, page 220, recommended change 2. There's a reduction of $65,524 for a duplicative QR codes contract. When we started Medicaid redetermination last year, we had a third-party service for notice generation as a backup, essentially, just to make sure that if we had any issues at all, we had an extra layer for generating notices, but we've since fully integrated those functions into Georgia Gateway, and the need is no longer there for continuing the contract. On the next recommended change, number 3, you'll see a $2,061,147 increase, which covers a price hike from our existing labor and wage data verification vendor. Again, that's in Georgia Gateway. It automates the process for how we look at income. And that increase is pretty standard. It was expected in the industry, so this funding will cover that for us. Still on page 220 for recommended change 2, under residential child care licensing, there's a $360,000 increase to improve what we call the Trails system. We use Trails to license child placing agencies, child caring institutions or group homes, and similar residential facilities for children and young adults. With this funding, we will be able to improve that technology to process applications faster, track incidents better, and deploy functionality to reduce actual paperwork. Right now, we have to have people mail things in. This will make it so that they can upload it more easily into the system, for example. In the next recommended change, number 3, there's $82,102 to establish an application and inspection process for qualified residential treatment programs, which I will explain more when I summarize the governor's FY25 recommendations. In our last 2 program budgets, there are no changes for the amended budget, and the remaining programs reflect administratively attached agencies, for which I always defer to their leaders when it comes to briefing this body, but with one exception. On page 221, recommended change 1 for the Safe Harbor for Sexually Exploited Children Fund Commission, you'll see $2,716,380 to increase funds for the full cost of the Gwinnett Commercial Sexual Exploitation Recovery Center, named Grace's Place by First Lady Marty Kemp. Over the past few years, in conjunction with DJJ, GBA, DBHDD, DCH, Gwinnett Public Schools, Together Georgia, and Devereaux, a national organization serving vulnerable children, we've worked to open Grace's Place, which is a brand new 24-bed facility with housing and transitional living, mental health counseling, substance abuse treatment, education, and medical services for adolescent survivors of sexual exploitation and trafficking. This facility fills an immediate need for children and young adults who desperately require this level of security and wraparound support in one place with the right care and coordination to heal and start a new chapter. The reality is, like our counterparts in every state, young survivors of exploitation and trafficking often reach us with needs we struggle to meet. These children and teenagers have endured unspeakable crimes, and they're reeling from physical and mental abuse. They may fear for their lives, and although it's hard to imagine, they may also try to return to their tormentors. But Grace's Place strikes the right balance where sending a child back home or to a foster or group home just isn't the right solution to keep them safe. So this state-funded, state-led, multi-year project is a truly first-of-its-kind endeavor, and it's one more tool to prevent hoteling for DFACs arriving at the perfect time so we can better serve survivors of exploitation in our care. And Grace's Place will start accepting referrals for young adults in the next few days. Next slide, please. So moving into the governor's recommendations in the big budget, since I already covered statewide adjustments at the very beginning of this speech, I will go ahead and skip adoption services and go to out-of-school care services, page 222. So on that page, recommended change 1, there's a $1 million reduction for one-time funding to bridge the education gap, which we allocated to the YMCA of Metro Atlanta to create or expand before school, after school, and summer programs. Since that time, and since we awarded that funding, they now have done some additional fundraising, is our understanding, and they are able to sustain that level of care independently. Also on page 222, but for recommended change 2, under child abuse and neglect prevention, there's an increase of $30,611 to reflect collections of marriage and divorce filing fees. Those are collected by probate courts and superior courts, and they're deposited into the State Children's Trust Fund, which is used by our department to serve at-risk families and children. So this addition reflects those collections. Although there are only statewide adjustments in child support services, the governor put new funding in the Georgia Technology Authority's budget, which, if you want to reference that, that's page 93, recommended change 1, in the Technology Empowerment Fund for STARS, which is our agency's child support system. Through the Division of Child Support Services, we use STARS to help custodial parents establish paternity, get court-ordered financial support from non-custodial parents, and offer programs to help parents overcome barriers to being more involved in their children's lives. In state fiscal year 2023, for example, over 428,000 Georgia children were supported by the division's work, and that was with over $670 million in financial support from non-custodial parents using STARS. So that's how we manage these cases. STARS, unfortunately, is over 30 years old, and this funding will allow us to make improvements to better integrate data, get rid of some manual entry, and shave hours off of existing processes to use the system. Next, in child welfare services, page 223, recommended change 4. The governor has included $214,146 to fully fund 2 community action treatment team pilots. These initiatives were first funded in FY22, with these teams serving as an alternative to out-of-home placement for children and young adults with complex behavioral needs. So far, those teams are available in 3 regions, and that spans a total of 33 counties. Once a family completes their work with the assigned team, they will have enhanced skills and support systems to maintain their child in their home where they are best served. And we've partnered with 2 companies to pilot these teams, Benchmark Human Services and Georgia Hope. Their models are based on a family-centered approach that includes assessment, treatment planning, individual and family therapy, case management coordination, individual and family skill building, and crisis intervention. And although their work is still in its infancy because it took a while to go through the contracting process, not uncommon for an agency, they already have a good caseload. They've been serving families in each of these regions already. And of course, for every case, we are literally talking about a family whose child may avoid entering foster care if we provide those in-home services. On the next recommended change, you'll see a transfer and increase in funding for a total of $1,418,935. Again, that's for technology improvements to SHINES, the DFACS child welfare case management system. And I mentioned earlier we may need to soon replace that system, but in the interim, this removes old, unsupported, and insecure components until we make that replacement. In recent years, you funded other big child welfare technology projects. So I'll quickly touch on those. We built a new platform, Argo. It's now available statewide, where DFACS would literally have to call and email every provider to see if they could take a child that's entered our custody. It's now all online. You can take it's a snapshot of available placements with matching criteria on demand. So saves a lot of time, far more accurate, gets a child put in an appropriate placement much faster. Communicare is the second big initiative that we've launched. It just went live, I believe, a few days ago. It makes case records available on demand to parents, foster parents, and court-appointed special advocates. So I know that you've probably had constituents complain about how hard it is to get records or information from DFACS. They don't hear back from their case manager. Well, now they can get it on demand, and we'll continue to expand that functionality. So that's going to be a huge benefit across the state. Okay. Still under Child Welfare Services, on recommended change 6, the governor has recommended $4,663,798 to increase salaries for over 2,100 DFACS staff providing child protection and placement services. So for social services specialists, which are more commonly called case managers or social workers, it'll raise starting salaries from a little over $42,000 a year with a bachelor's degree and almost $46,000 a year with a master's degree to $50,000 and $52,000 annually. And again, with recent workforce investments, including the $1,000 bonus, the recommended COLA, and this targeted increase for staff on the front lines, we will reward some truly amazing people who literally keep Georgia's children out of harm's way. And, you know, they don't often receive recognition for their work. And in fact, they regularly bear the brunt of some unfair and inaccurate criticism, allegations that they've taken a child away from a home on baseless claims or with no oversight. A judge signs off on the facts and the actual removal of every child that comes into DFACS custody. But they're also constrained by federal and state confidentiality laws, and what that means for them is that they can't refute misinformation. So even if something's all over the press or all over social media, these frontline workers can't get out there and correct the record. And they often deal with threats to their personal safety. I had a case manager in Cherokee County tell me one time that she went to remove some children, and one of the men in the household flashed his Glock at her. She's 23, and you can just imagine how tough that can be, how scary. But they work weekends. They just love doing the work, even with these obstacles, and they are saving countless lives and helping countless families and have been doing that for years without accolades. So this salary increase, if supported by this body, shows that these workers are appreciated and they are valued, and that the state treasures the people who put our kids first, even on the toughest days. And again, just to give you an idea of what it looks like on a day-to-day basis for them, when law enforcement arrives at a crime scene and there are children involved, either DFACS is right around the corner or they're already there. DFACS frontline workers are knocking on doors in the middle of the night in dangerous situations all the time. Sometimes they have police escorts, sometimes they don't. but it's when you have to investigate abuse or neglect, that's what you do. They don't have protective gear. They don't have body cam footage. They've got a pen and paper, and they are there to serve the most vulnerable. They are the ones taking care of our kids when they enter custody, when those children have no one else. And it is the absolute worst day of their lives, but these frontline workers stick around to lessen their loneliness and help their family. And of course, being up here, it would be impossible to convey the true value of their work because it is so much more and so much deeper, but they really deserve this reward. And we humbly ask for your support of this increase. Since there are no changes to community services, I will go to departmental administration. I'm still on page 223 if you're using the tracking sheet. Just to quickly note, changes 3 and 5. Again, an increase in funds for rent and a reduction for savings following office consolidation. On the next page, 224, in elder abuse investigations and prevention, recommended change number 3. There's a transfer of $590,000 to align the budget with expenditures. And again, those are related to disregards. Since the only changes in elder community living services are statewide adjustments, and there are no changes recommended for elder support services or energy assistance, still on page 224, for federal eligibility benefit services, first, a recommended change number 5, there's a $2,061,147 increase, which mirrors an increase in AFY 24. Again, it's a price increase for labor and wage data verification services. On recommended change 6, there is a $1,681,569 transfer from Departmental Administration, and that is just to move that money into the appropriate program budget for us to better track our expenses related to technology for that program budget. On recommended change 7, there's a $630,057 increase to hire 23 staff as we continue to reopen county offices for more hours. Due to the pandemic and its aftermath, like many agencies, we reallocated funds from vacancies to technology investments. A lot of that was to get ready for Medicaid redetermination. Now that we're reopening offices and we're training nearly 1,000 new caseworkers hired last calendar year, we are asking to plug that hole. And with this funding, we will now be able to fill those roles for more in-person assistance at local offices. We have some counties that are already open 5 days a week. They're fully reopened, the biggest counties, but we have others where they're still at 4 or 3 days because we just don't have someone to man the front desk and be able to assist people. Slide 7, please. I'll go to residential child care licensing. There's a $134,618 increase to establish an application and inspection process for qualified residential treatment programs. The residential child care licensing unit in our agency will license those new facilities, and this funding will allow this unit to onboard more inspectors and compliance specialists to fully implement these programs. There are no changes to the remaining 2 program budgets, support for needy families for basic and work assistance, and the remaining programs cover attached agencies. But again, I'll touch on the Safe Harbor Commission. There is $4,746,840 to fully fund Grace's Place for ongoing operations. And for the next recommended change under the Safe Harbor Commission, there's an increase to reflect collections of financial penalties from adult entertainment establishments to the tune of $54,120. I will quickly touch on, or just to tell you, echo our support for recent funding that this body has put into the Division of Aging Services. We have been able to expand Georgia MemoryNet with assessment clinics in 3 new brick and mortar locations in Gainesville, Vidalia, and Savannah, along with more telehealth options. That means that Georgians across the state have more access to diagnostic services and care related to dementia. And I will quickly touch on our legislative agenda. My understanding is a bill from last year for the Division of Aging Services, House Bill 571, is likely on the Senate floor early next week. We would love to have your support. Next, Senate Bill 342, sponsored by Randy Robertson, would give DFACS authority to share more information about runaway and missing children directly with the National Center for Missing and Exploited Children, or NCMEC. Right now, we can't give that directly to them. It has to go through law enforcement. So they still get that, but of course, this would be a far more helpful mechanism for us. And I just want you to know that even with those current restrictions, compared to our counterparts in other states, Georgia DFACS has been a leader when it comes to tracking, reporting, and recovering missing and runaway foster youth for many years. It has long been the view, long before me, that one missing or runaway child is one too many. We are constantly reviewing practice and policy to stay cutting edge on what we do. But as a social services organization, we know that we cannot prevent every occurrence, and we may never fully understand why young people, especially survivors of sexual exploitation and trafficking, run away, sometimes right back to their abusers, and often more than once. But what we can do is we recognize the complexity of these cases, we stay vigilant, we document extensively, and we engage the right people, including law enforcement, to get our kids back home safely. In the coming weeks, we will introduce 3 additional measures: 1, to join 16 other states to modernize the Interstate Compact for the Placement of Children; 2, to update terminology related to the work of the Division of Child Support Services regarding income withholding orders to better align with federal law; and 3, regarding qualified residential treatment programs, which I've discussed is a new license type for facilities serving youth with complex needs. As you know, we desperately need more mental and behavioral health capacity for Georgia's children, both in foster care and not in foster care. And this measure will kickstart a pilot between DFACS and our provider community with more intermediate step-down care between inpatient treatment and community-based placement. I will officially conclude with a visual. It is not particularly fancy, but it is the depiction of 2 years of work to better serve children and young adults in foster care and end our reliance on hoteling, if you'll go to slide 8. I'll go ahead and note, if you look at this graph, DFACS did not start actually tracking every instance of hoteling, which is a temporary office or hotel stay of a foster child, until July of 21. That's when I moved over to the agency. So you can see that it starts to climb as we document more. For many years, we have been forced to place kids in hotels and county offices, which we call hoteling, due to a shortage of appropriate placements. Several before me pledged to end hoteling, but I stood before you last year and I told you that we were hell-bent on ending this practice, and we were laser-focused. And through the governors, lieutenant governors, speakers, and your support, we put ourselves under the microscope, so we had to stay accountable. And we were vocal about the problem, and we acknowledged the system's shortcomings, and we put everything into reducing our reliance on temporary hotel and office stays, tackling this problem with our providers. We could not have done this without them, deploying every possible solution we could think of, and frankly, at times, looking like we were going to run out of money. But knowing it was worth the extra resources to place the child in a safe environment at extra cost with extra support instead of a hotel or office. So again, there were days when we were seeing a lot of red in the books, but you provided the tools and the resources, state money, not just to keep us afloat, but also state legislation to help us get the job done. And you supported our efforts even when criticism, right or wrong, reached all-time highs. Just a few months ago, in the midst of a particularly brutal and honestly unfair round of publicity, a juvenile court judge called me, and he was not the only one, and I know there are several of you in the room that called me too, just to lift my spirits. But in this particular call, he asked if I'd seen a recent video of Kirby Smart talking about the costs of leadership, and I will definitely oversimplify, but Coach Smart talks about how great leaders will have to make decisions that negatively impact people they care about, and they may be disliked, and they may be misunderstood, and they may not have a chance to defend themselves. I'm sorry. But that call and that video has stayed on my heart, because I realized that even in the toughest of times, Georgia is immeasurably blessed with state and local leaders that are willing to accept those costs. And I'm talking about our First Family in this legislature. My fellow agency heads and nonprofits and judges and advocates and foster families and group homes and healthcare partners and attorneys and frontline workers. That's how Georgia ended hoteling, and it started under this gold dome. Of course, our agency still has its challenges. We are still emerging from COVID. The very nature of our work means we're making serious decisions, often life or death, and we don't always get a chance to defend those decisions, especially when confusion and misinformation make the rounds. But we keep rolling up our sleeves and jumping into the fray, and you're right there with us. And of course, big issues don't develop overnight. There are never easy solutions, but we are determined to fix them. And as we continue those efforts, we are already running more efficiently. There's more accountability. Staff are better compensated. Thank you. And we're making important decisions with better information. So that's what is really great to see about the simplicity of this graph. Together, we achieved what felt like the impossible. And on any given night in Georgia, DFACS is no longer housing 50, 60, 70 foster kids in offices or hotels. We have been at zero many, many nights, at zero for weeks in the biggest counties with the highest foster care populations. And that's not to say we don't still have emergencies. You know, last night we had 3 teenagers with very complex needs that had to be hoteled. They have caregivers with them, but the reality is they need clinical treatment. They need inpatient treatment, and there are wait lists, and we have to compete with other states and other payers, and those are emergencies. Those are always going to be around. But 3 today is really high for us. And all 3, there are occasions where a foster group home just isn't the right fit. So that reliance on hoteling is gone, and we've brought more homes and providers into our ranks. And we know there's more investment on the way for mental and behavioral health capacity for our kids, and we really feel like we've done the impossible and we're ready to do more. So thank you for your investments in our agency and your support along the way. With your approval of the governor's recommendations, we'll get to continue some amazing work, and I really believe I have the best job in state government. We appreciate your support, and I'm happy to answer any questions.
Thank you, Commissioner. We appreciate you. We appreciate all you do and all the passion you have for the job that you do every day. You do have some questions. Chairman Kirkpatrick.
Thank you, Mr. Chair. And at the risk of irritating the chairman based on his earlier remarks, I just want to thank you for bringing the hoteling issue to the attention of the General Assembly last year.
Thank you.
And congratulate you on the great progress. Obviously, it's not solved, but we're making great strides. The question that I have is, as you noted, one of the issues that we've identified, and this was highlighted in our Senate Study Committee on Foster Care and Adoption this summer, is the high turnover among our frontline caseworkers. And we know that money is part of the equation. What else can we do to improve retention, because that's so important to the outcomes of the kids in state custody?
Yeah, pay is a huge part of it. You know, with this increase, it would just be life-changing for these frontline workers. And they don't do the work for the pay, I can assure you, but the pay prevents them from being taken away from the job out of necessity. And so, you know, that would be an unbelievable investment in some important and hardworking people. I would also say too, though, that if there is ever an opportunity for you to be supportive of your local DFACS, again, almost every time, DFACS just can't really argue back with misinformation or something that's inaccurate. And so if you get a chance to praise them for the good work that they're doing that often goes unnoticed, or just, you know, swing by. Some people drop off like a box of diapers, for example. Not a huge gesture, right? But that is immediately put to good use. Those kinds of things go a long way with keeping morale high. And that would be an amazing change if we could see that more from the public.
Thank you, Chairman Tarbin.
Yeah, thank you very much, and I'll be very brief, which is unusual for me. But this is not any reflection on the money, because the money is not the motivator. My question is, and you can answer it later or now or whenever, but something I'd like to know is the longevity or seniority of these caseworkers. And do we have something in place? Obviously, they're driven by loving what they do. Do we have something in place for their emotional and mental well-being after seeing everything they see? And is that something the state has in place?
We do offer that through the state health benefit plan. You know, in terms of how often it's used, I don't know that offhand. I will tell you, a lot of people just compartmentalize it. They take it home and ruminate over it. Not the healthiest strategy to deal with trauma, but that is what frontline staff often do.
The turnover is really, is it pretty high? Or?
Yeah, so I think for frontline workers, I think in child protective services, foster care, I think this is true for even adult protective services. You kind of see this divide between people that leave after, a few months, and then sort of the status quo, and then they leave after a few years. So there's this sort of divide. They either jump out pretty quickly, or they just can't handle it after being in the field for a few years.
We hear all the things that you hear, and squeaky wheel gets the grease, and the main thing, I appreciate what you guys do, and the hotel thing was huge. It's just a tremendous what you've done on that. Thank you.
Thank you.
Senator Sims.
Good morning. Thank you so much for your presentation. On page 223, there will be a pilot program or pilot programs in 3 different regions. Was that your, okay. Are we included in Southwest Georgia?
So the regions 1 and 2 for these, I think you're talking about the community action treatment teams. Regions 1 and 2 are really North Georgia, and then region 12 is south, like coastal South Georgia. So we're hoping to continue to expand, but those are the 3 main areas right now.
Hoping?
Sorry?
Hoping?
Hoping. Well, we want to make sure that we can demonstrate that these are efficient and effective pilots. So because we still are pretty early in deploying them, I wouldn't want to ask for a statewide investment just yet until we can prove that it works well for families. But
thank you so much.
Sorry.
Southwest Georgia is probably one of the most challenging quadrants of the state. So we would appreciate being included when things like this come about.
Absolutely.
Thank you so much.
Thank you.
Representative Al Williams.
Thank you, Mr. Chairman, and thank you, Commissioner. Keeping in mind that domestic violence calls are near the top of the danger zone with police officers, do you have anything in place for the security of caseworkers, particularly making calls at night?
Well, fortunately, we have great partnership with law enforcement. Some areas it's closer than others, but often what we do when we know that there's a potential threat along those lines is we'll ask for a police escort, and we're almost always obliged. The issue, though, is that that's that initial interaction. Sometimes we can't have an escort, but sometimes, or not sometimes, in each case, if we continue working with the family, we can't ask for that every single time that we go out there. So the safety of our caseworkers is certainly something that's been weighing heavily on my mind. We do have an alert system that we've deployed statewide. That's just one thing, though. So we're certainly trying to explore additional ways to keep them safe and make sure that there's some documentation of what occurs there if something goes awry.
Representative Mary Margaret Oliver.
Good morning.
Good morning.
Well, I support the salary increases. Those are very important.
Thank you.
I'm trying to understand your vacancy rate right now because we've been comparing it with other agencies. Last year, your vacancy rate for child protective service workers was in the 40s. What is it today?
I can pull a report. We just had one generated, so, and I don't have it right in front of me. The difficulty with specifically DFACs and vacancies is that that division, not the agency, just that division, still keeps their personnel management, vacancies, filled roles, all those things in a different system than basically every other state agency.
But
So
I'm
we don't
told
track what's funded and unfunded, so it's really hard for me to say before we migrate to the new next gen.
But it's over
system.
45% vacancy, right?
I'm not sure that that's accurate, but I can get you the actual figures to the best of our ability to calculate them.
One follow-up, please. The success of ending hoteling means that you have transferred that money, that big glut of money that was going for the hotels, to something else. Are you, and done some really good work about provider increases? Are those temporary provider increases for these hard-to-place children going to be permanent, or where are we on provider increases for these difficult-to-serve children?
What we're doing right now is, because of the additional flexibility that we have and we're not paying for a hotel and the related expenses, is that we're putting that money into what the provider's per diem rate is and what additional supports they need. So for each child, we're basically taking it up on a more case-by-case basis. And so that's where the money is being spent.
On a permanent basis, can you give us some guesses or some good, you've got more than guesses, really, what do we need to do for provider rates going forward to make sure this doesn't happen again? Thank you.
I'm going to try to keep this framework in place for as long as possible. It looks like we're going to continue to be able to fund it this way. It doesn't look like we're going to run into the red. So from my perspective, it is permanent, although I always tell our providers, bear with us. We never know how many kids come into foster care in a year, certainly not even any day. It's hard to project total kids in custody. So that's always the caveat whenever we're talking about that kind of funding. Thank you.
Chair Lady Dempsey.
Good morning.
Morning.
I want to start off echoing what you're already hearing here, but thanking you particularly for hoteling and for the focus that y'all have certainly decided to put on that. Your results are quite impressive, and we're grateful for that, and we're grateful for what that means for children in your care particularly. I hear you speaking to the challenges in technology. Very aware of them. Did the data sharing bill a long time ago to make this possible, and I know we haven't done our part on bringing that money forward for many reasons, but when you speak to Shines and Stars and some of the good things that they are doing, but the challenges that are there to not get us where they need to be, I think of particularly information traveling quickly when a child is found in need, for tracking and following families, for immediate alerts. So I want to ask you, because we care about it, what we can do to help you with that in some very, very specific ways. I applaud what the governor's budget and what we'll be putting forward to help those systems continue to work. But I want us to really look at what we need to do more and go way beyond this, because it will save lives and help your workers as well.
Right. So Shines is a really old system, and it's not user-friendly at all. From my experience, I can literally type in a family or, person's name to look up history the exact same way one time, and I type it in the exact same way a second time, and I'll get different results. Shines, you can't actually search keywords across the database. So you can imagine that's really problematic. If you're trying to look up maybe a place where abuse or neglect is occurring and not just a person, that's not really a function that exists in Shines. So I would say, while we modernize it, I'm probably gonna, or hopefully, come back and ask for a lot more money to replace it in next year, or in the next 2 years. It's got to be replaced. So much of, I truly believe this, shortcomings in DFACS casework can be completely chalked up to an ineffective system, and it's time for Shines to be retired.
So is there something you think we could do to help expedite that and not make you have to wait 2 years? Because every every day we're losing children over issues like that.
Any funding like this money helps us with making the system talk better to other systems. Right now, another good example is we're working with the Georgia Department of Education in an MOU to get a child's unique student ID number faster. If we don't have that number, we can't unlock their database to get the child's records to show where they're at in education, IEPs, if they haven't been going to school. So that often takes weeks. I mean, can you imagine, like, we're having to search for weeks to find a number? That's what we literally do. So things like that, this funding right here, any funding that goes to Shine's modernization right now means that we can make the system talk better to other systems and share data and automate. You know, right now, case managers literally type in their notes into a narrative every interaction that they have with a family, every phone call. So if you want to review a case, you have to read every single narrative. That is just not the way people operate any longer, and it's not particularly effective use of their time. So that's another thing that just modernizing it right now will make a huge impact on their day-to-day work.
Well, we're committed to help there.
Thank
I know, without a doubt, I think. But I want to say that every person in this room, we are all subject every day to harsh judgment.
Yes.
This is probably a place where the judgment is unbelievable. So thank you for your willingness to be there, for what you are doing, for your insight and your perseverance.
Thank you. Thank you for your support. Sorry I got emotional. I'm really
No,
appreciative for
we're
your
not done.
investments. Okay.
We are behind, but we have 2 more questions, so please make them brief, as I have asked earlier. Representative Hughley.
Thank you, Mr. Chairman. Thank you, Madam Commissioner. In our area, our schools are concerned that when foster children come, they don't have the record. Also, they don't have any picture identifying them. And we had a situation where a child left the school the first day they were there, and the school didn't have anything to work with. So where are we in automating or getting electronic records that will follow these children to take care of school records and medical records when they arrive wherever they're going?
For school records, once we get that deal done with the Georgia Department of Education, that's going to be a huge change, almost immediate, where we're able to get those records faster and get them to the right people more quickly. That should be in the next few weeks. We'll have that deal done. So you'll feel that in your community. In terms of medical records, it's something that we're working closely with the Department of Community Health on. There's right now, under the current CMO framework for the Medicaid that foster kids get, there's not really a centralized place for their medical records. My understanding is that's going to change as they go through re-procurement and whatever a future contract looks like with a managed care company. If we can get those records centralized, that would be amazing, because it also stalls a potential adoption. A lot of people don't realize that if we have to find every medical record the child's basically ever had to be part of their adoption record for it to move forward, and that takes months. So if it were centralized, that would cut a lot of time off of getting that child to permanency. For IDs, I know it's something that Chairman Kirkpatrick's committee has been looking at. They looked at it over the summer, and it's certainly something that we would love to have for our kids, and we'd be happy to implement if that's the authority that the legislature would like to pass our way.
Representative Seabaugh.
Thank you, Mr. Chairman. Thankfully, most of my questions have been answered, so this will be quick. But Commissioner, you never have to apologize for being emotional. What you and your staff do is extremely emotional. It's an emotional roller coaster, and we appreciate you stepping up and taking the tiger by the tail. I did have one question. While I appreciate the salary increases, how do those new salaries compare with private industry?
I think probably the biggest group that is able to take a social worker away from us, those are schools. Generally, schools are going to pay, I'm kind of speculating, but if I remember correctly, like almost immediately about 10 grand higher than what we pay. But they're not on call if they're working for a school system, and they get far more breaks and sometimes better benefits. So that's the biggest source. Otherwise, then we lose them to some of our providers, which is understandable. Hospitals, that's a much higher jump in terms of pay, almost immediately.
Commissioner, we're going to take one more. We're going to go to Senator Burns, or Chairman Burns, and then wrap it up.
Thank you, Mr. Chairman. Good morning, and thank you for the good work. We appreciate the services you provide to Georgia. Quick question. How many current offices are not fully staffed or open around the state, and what is your plan to maybe reconcile that challenge?
So what I'll do is I'll send like a map to whomever you'd like for me to send it to share with everyone here today. But we have it in 3 tiers right now. We have tier 1, which are the biggest counties, 5 days. Tier 2, sort of medium-sized, 4 days. Tier 3, smallest, most rural counties, 3 days. And so I will send that map out. The goal would be that there is an increase in funding in the budget so that we can hire the people to staff the front desks. Once we have them, we will be fully reopened statewide, 5 days a week, standard hours, back to normal out of COVID.
We appreciate that. I have a lot of rural counties that need services. Thank you.
Thank you.
Commissioner, thanks for being here. There's one thing I do want to say. Thank you again for hoteling. I know we worked hard on that. I do think I need to give one brief shout out, though. The reason that issue started was because of a staffer.
Yes.
A staffer highlighted hard our former budget director and kept it pinned to the board. Melody Debussy, and then Caitlin Little, and the work she did on that in the Senate Budget Office, combined with a lot of other people too. Dr. Burke, Dr. Kirkpatrick, Dr. Watson, working with Commissioners Cagle, Noggle, I apologize, Carlson, I'm mixing them all together. And then what Chair Lady Oliver, Dempsey, Chairman Parrish did in the House Budget Office. Thank you, Chairman Hatchett and Christine, for really adopting and pushing this. It was a 2.5-year endeavor with all of that push and the support of the governor. I highlight this for you, though. What we were able to do is stabilize. We were able to make sure they're out of a position where we thought they were dangerous, and now they're in a home, less dangerous. We now have to make sure that they have the services that they need in that home. We can't just simply push them from one place to the next. Thank you so much for what you've done to help move this problem, and look forward to continue to working with you over the next couple of weeks for this.
Thank you. Certainly was not me. It was a group effort. It was amazing, and I'm really honored to be here to share that with you. Thank you.
Next up is Commissioner Kevin Tanner, Department of Behavioral Health and Developmental Disabilities. You missed my instructions. Ask questions. Most people abided by it. Commissioner Tanner.
Thank you, Mr. Chairman. Appreciate.
I know you talk fast, but you can even talk faster if you want.
Well,
I'm just kidding. I'm kidding. We're already behind, but all this is very important. Important subjects, and the floor is yours.
I was just instructed by Representative Steve Tarvin to get you caught up, so I'm going to do my best to help. All right. Well, thank you for allowing us to be here today. We appreciate the opportunity, appreciate the support of this Appropriations Committee, both the House and the Senate, for continuing to help us make improvements in the lives of some of our most vulnerable citizens here in Georgia. I want to start out with FY24 adjustments and go through that briefly with you. Obviously, some of this is statewide adjustments. The first item up there, the $9 million, we want to highlight the one-time $1,000 bonus. We appreciate the governor and appreciate hopefully the support of the General Assembly for that. That's helpful to our employees. It means a lot to them. And on behalf of them, they want to say thank you to the General Assembly for your help. This also includes the employees at CSBs. So that's going to be a much needed bonus from additional dollars for our CSBs across the state also. Also, looking at the just over $59 million, and it shows you there the $7.6 million direct support transfer. That's primarily coming from some disregards in the governor's budget when he executed the budget last year for this fiscal year, and those dollars have been transferred over to make up almost $60 million. It's going to be going directly toward improving our facilities, and we're going to talk more about that. The Georgia Building Authority, in conjunction with our department, did a very in-depth hospital report. We have, many of you have been on our campuses, so many of you know that most of our newer buildings are around 50 years old. A lot of our other facilities are much older than that, so obviously we have a tremendous challenge maintaining properties. So I want to give a shout out to the Georgia Building Authority for bringing on an expert to come in. They visited every building on every campus across the state and really looked at what the needs were, and they put together a report. We have 239 buildings across 856 acres in our system. Some examples of items that they found that needed to be replaced was HVAC systems, roofs, floors, windows, doors, remediation for water damage and other damage to the buildings, replacement of drain lines, sewer lines, and fresh water lines, with a total cost that they identified was over $87 million. So we want to thank the governor and his budget proposal to the General Assembly. He includes in this area for FY24 amended just under $60 million. So that'll go a long way toward solving and helping with our building problems across the state. Going on into the FY25 statewide adjustments, you see here the $27 million, which is the 4% cost of living, which is again statewide. The teacher retirement, again statewide. And then the other items there, for the most part, are statewide adjustments. I will point out the $4.9 million transfer. That comes out, again, primarily through the disregards in the governor's FY24 budget that he signed. Some of those disregards he allowed us to go ahead and expand, which included a hospital pay package. But because that wasn't done at the beginning of the fiscal year, there's savings there. Those savings are being transferred here, and we'll talk about where the governor's placing that money. So that's primarily where those dollars are coming from. I want to talk a little bit about the workforce at the hospital. I know my cohort, who's doing a wonderful job at DHS, talked a lot about workforce, and I know you'll hear that from other agency heads. It's our biggest challenge. I've said for the last year that we're in a state of an emergency when it comes to our state workforce, and that's a true statement. But I want to give you a little bit of good news, and it's really because of the work that this General Assembly and the governor has done over the last couple of years of investing in our employees that we've been able to start turning the tide with our hospital workforce. We lost over 1,200 employees in our hospital system during COVID. Healthcare is one of the most competitive workforce markets in the country and definitely in the state, and it's especially competitive in the Atlanta and Savannah markets where we have two of our hospitals. So we lost a lot of individuals during COVID. We've been able to gain back 51% of those individuals, and you can see a lot of that's occurred since the pay package that this General Assembly passed, and we've been able to implement this current fiscal year. So we're making progress. Our HR staff, in conjunction with our hospitals, are doing hiring events. We've found ways to do same-day interviews. We've been able to get fingerprints and criminal history backgrounds back same day. If you're in the private sector and you're trying to hire people in today's market, people are impatient. They're looking for instant feedback. The days of being able to take an application and wait 2 or 3 months before you get back to the person are just over with. So the state's going to have to adjust to the new norm, and we're trying to do that, and it's having a direct impact. So we appreciate the infusion of cash into this program. We want to continue to improve in this area. I will tell you, we've got some challenges. We have a 57% millennial turnover rate, retention concerns. 29% of our employees are eligible for early retirement within the next 5 years. And obviously, we have a compensation gap between our healthcare workers in our hospitals and the private sector. On average, it's 19% below market. We did a major workforce study this year because one of the things that I believe in is data and making data-driven decisions. So we have done, we've provided that to the governor. We will provide that to you throughout this process, looking at where we stand with market and also looking at, because it's more than just pay, there's other factors in retention, there's other factors in recruitment. And one of the things that's important is we've got to have a good image, because one of the things I heard early on from one of our hospitals is Google us and tell me why anybody would want to work here. So we're working hard to change the image of DBHDD, and I think that's working, and I think the numbers show that. The other thing that I'm proud of is June of 23, we were spending $1.6 million a week on Jackson Healthcare. Today, we're spending $1.2 million a week on Jackson Healthcare. That's a savings of over $20 million a year. My goal is to get that down to zero over the next couple of years. Next slide, we'll go into the FY25 budget adjustments. Talk a little bit about that. Again, last year, this General Assembly over the last few years has really invested into the now comp waiver program. I know you get a lot of phone calls about that. You hear a lot about that politically. Those are individuals who have a developmental disability, who need services. We have over 13,000 individuals currently on now in comp waivers in the state. We have a planning list of just over 7,300 individuals. You have funded over the last several years quite a few new waivers, and we have a need to continue that. Last year, in this current fiscal year, last budget cycle, you funded an additional 500. So the 9.3 is the dollars necessary to annualize that number. And then the 2.3 is the number necessary to fund 100 additional now comp waivers, which is the governor's proposal. The next item, which is extremely important, and I'm extremely proud that this number is in there, is to fund the rate study for the now comp rate study, $79 million. This is paramount to us being able to address the private sector workforce and getting enough providers into the system. And I will tell you, we are excited, our providers are excited. One of our challenges to being able to really serve the number of people that we need to serve with now and comp waivers is the fact that we just have a lack of providers. So I told you last year, and I told the Appropriations Subcommittee last year, even if you gave me an unlimited amount of waivers, we still would have a wait list because of the lack of providers. So step one is building a strong foundation, and that's what you're doing by increasing the rates that are being paid. They haven't been increased in many years, and this will result in about a 40% increase in rates to our providers. So we're excited about that. I will also tell you that and I'll go to the next slide. This shows you a little bit of history of how many people the department has enrolled on a yearly basis, going back to pre-COVID, where we were up at 900. During COVID, the department, through budget cuts, had to cut a lot of administrative staff that was working in this area, which resulted in less people being able to be enrolled. We've been able to get back up to FY23, 623. And then, so the question you probably will ask, you're only funded for 100 for the next fiscal year in this budget request. But let me tell you what's important. We have really done a good job looking at how many people will roll off waiver services. And that's whether it's through natural death, or whether it's they move out of state, or maybe for whatever reason they no longer need services. And on an average, we will lose about 400 people a year that will roll off waiver services. So with the additional 100, we will actually be able to enroll an additional 500 total. My goal is next fiscal year to ask you for an additional 500, and I think we will be able to lay out a clear plan that there will be no one in need of a waiver that we're not able to fund at that point. And we're also increasing our administrative staff back to pre-COVID levels currently, so we'll be prepared to enroll around 900 individuals a year. So in a future budget year, if you fund an additional 500 waivers with the natural attrition we have, we will enroll an additional 900 individuals a year. So we have a clear plan to make that happen. The other thing I want to do is mention to you is we put together an IDD work group. Senator Ben Watson has served on that work group along with a lot of our advocates and people who represent advocacy groups, our experts internally at the department, and they've looked at the planning list, and over the next year they're going to continue to work to be able to create subgroups of that planning list, because I think what's important is on this next slide, not everyone who's on the planning list needs a waiver today. You can see here, this is a scoring system that's used, 0 to 156. The higher the score, the greater the need for a waiver. You can see we currently don't have anyone that's above the 119. So people who are in desperate need of a waiver are able to get a waiver. A lot of the individuals who are on the lower end of the spectrum are children who are in the school system, and they're currently receiving services through the Department of Education. The important thing of the planning list is we need to know these people are coming into the future. We need to be prepared to provide them services when they need it. But it's important for you to understand, not all 7,300 people on that list actually need a waiver today. We're just preparing for future needs out into the future. The IDD work group has really taken a deep dive into this, and they produced their first report for this year, and we will be providing a copy of that to you, but we're also excited about the work that's going forward and how they're going to be able to really tackle this planning list in a different way than it's ever been talked about before. One of the other things that I think is important, because I know I get phone calls about this, and I know you get phone calls about this, and these are individuals stuck in a hospital that have an intellectual developmental disability. This is an all-time really high for us. We were averaging around 24. We're up to now 34 individuals on this particular day, January 3rd, who was in an emergency room that was in need of our services. These are typically individuals, you can see 24 of those were known to the department. They were currently enrolled in our services. And I will tell you what happens often is the provider they have, for whatever reasons, not able to care for that person, maybe behavior issues, etc. So they take them and really just give them up at the emergency room. The 6 of the people were on the planning list, and 4 were just unknown to us. Oftentimes families may be taking care of an individual. We don't know the person even exists. Family member dies, circumstances change, person ends up in an emergency room. This is an area that we need to tackle. I've challenged our team internally. I said, look, I am tired of getting phone calls from CEOs of hospitals with these individuals being stuck there. So they've laid out a clear plan to make sure that's not the case in the future. That's a work in progress. Part of that, we're going to be able to build that infrastructure this year. Some of that's already underway. I know Chair Lady Dempsey joined us for a ribbon cutting down in Macon at the first ever state crisis center for developmental disabilities. We're excited about that. It's going to have 16 inpatient beds, and their primary mission is to get these people out of an emergency room, get them into a center and get them stabilized and get them into community placement. But what I'm really excited about that facility is the outpatient facility that's going to be there. We're having negotiations with Mercer Medical School. They're going to be providing the outpatient services there at that facility. This is going to become a national model. We'll have doctors, and it'll be integrated health care that'll be experts in providing treatment to these individuals, and they'll be able to telehealth back to the local community doctors and help the local doctors care for these people once they get back to the community. This is an extremely important step in the right direction. The other thing we're doing is we currently have 2 houses in the Augusta area. They are across from Gracewood there. I know Chairman Burns visited that, and we enjoyed that opportunity. I will tell you that those 2 houses have 4 beds each, and they are also designed to get people out of emergency rooms. We also are in conversations with Savannah about some property there to be able to do 2 additional houses, and we have a plan to continue to be able to work forward to get this population taken care of. So thank you for your support and all those efforts over the last few years. Now I want to go into a little bit more detail about the Now Comp waiver study, which the governor is proposing to be fully funded. The total cost of that's $107 million in state funds. In the budget, there's just over $79 million in FY25. The delta there will be taken from available ARPA funds, so this would allow for full funding of the rate study. This again is a game changer for us because it's going to result in about a 40% increase to providers. It's one of our biggest barriers to success is not being able to recruit providers and providers not being able to pay a livable wage. So this is going to be a game changer, and we're thankful for the governor and the General Assembly for pushing this forward this year. The next slide goes into FY25 budget adjustments. I want to discuss a couple of these particularly. One I'm excited about is Operation New Hope. If you'll recall when late Speaker David Ralston, when House Bill 1013 passed, he stood in the rostrum and he said, "Today Hope won." We have a lot of people who are in our hospital system who have been there a long time. On average, our population who are an adult mental health population who have been sentenced there for not guilty by reason of insanity have been there 9 years. We have a lot of people who are clinically ready to get out, but the judges are reluctant to let them out for obvious reasons. So this will be the first ever state transition facility within our hospital system. We're currently renovating 30 beds at the Savannah Hospital for Operation New Hope. Our staff there is extremely excited about this. They'll ask the court to allow the person to come into this facility at the hospital. They'll start learning life skills, financial planning. They'll go to technical school, GED, whatever the needs are for that particular individual. And then ultimately that person will be able to go out and get a public job, come back at night, ultimately work their way into a community integrated house, and ultimately into a forensic apartment, and ultimately out of our system. So our staff's excited about this. This will not just take patients from the Savannah Hospital. We'll be able to pull patients from our entire system. So the governor has proposed funding to cover the operational cost of that. We had dollars already that we're able to use to do the renovation. And then you see a reduction of core services. During the downturn, during COVID, all of our CSBs, all of our providers lost employees. They were not able to serve the same number of people in community that they were able to serve before. So as a result of that, not as many people are receiving services, and as a result of that, there's some dollars that have not been expended. So we feel comfortable with this reduction. I will tell you, as the workforce comes back, these dollars will have to be restored out in future out years. But for FY25, we feel very comfortable with this reduction. That part of the 11.4 million is 10.4 million, and the additional 1 million is for contracted beds. We've got an emphasis at the department to reduce our reliance on private psychiatric beds. The state spends a lot of money on that currently, and we're focused on that, so we're reducing that cost by $1 million in this proposed budget request. I know all of you get a lot of phone calls about the forensic population. Sheriffs, judges are upset. They're not happy because their people are stuck in their jails waiting on a hospital bed. I know you get calls about people who are homeless that need our services. The reality is Georgia just does not have enough inpatient beds. We have, as you can see here, we only have in the entire state 641 forensic beds statewide, 298 adult mental health beds in our hospital system. Out of those 641 forensic beds, half of those are taken up by people currently who have been ordered to the hospital not guilty by reason of insanity. And if you remember, on average, those people have been there 9 years. So that means half of that 641 is not turning over on a regular basis. That means I only have half of those for forensic restoration. It's put us in a situation where it's just not sustainable. I've already been held in contempt in one county in the state by a judge for not getting someone in the hospital. So we've got to address this. It's a challenge moving forward, but it is one of the core responsibilities our department has is to the forensic population of this state. I was at the Sheriff's Association recently. They were not happy. It was not a pleasant experience. I can assure you we're doing all we can, but it is very challenging. I will tell you, though, there is some positive news. This shows you the pending forensic evaluations. These are people who have been ordered by a Superior Court judge or a state court judge or a juvenile court judge to have a forensic evaluation. Those have to be done by one of our forensic psychologists. We got up to, the blue line is the adult population, to 1,374 pending evaluations, people waiting on an evaluation. We have contracted with, I'll give you one quick example, in Hall County. We went to Bernal University and we've contracted with the psychologist at Bernal University to become a 1099 DBHDD employee. They're handling the evaluations in Hall. We went to Augusta. We've worked with Augusta University, contracted with them to handle the evaluations in that area as 1099 employees. We went to Chatham County in Savannah, and we've contracted. We've just recently entered into an agreement with Morehouse and Emory to create a new fellowship program for psychiatry. And as a result of that agreement, they've agreed to do all the juvenile evaluations in Fulton County. So we are looking at under every stone for a way to improve the system. We have about a 34+% vacancy rate in forensic psychologists here in the state. We just pay them below market. It's very difficult to recruit. But the good news is we're turning the tide on the number of people waiting on an evaluation. But here's what gives me heartburn and keeps me up at night, and that is the forensic wait list for individuals waiting to come to the hospital. We've had a 195.96% increase in this since April of 2020. People say, well, what happened? Well, COVID happened. COVID was the perfect storm. COVID, we lost 1,200 employees in our hospital, which means beds were offline. We had the courts shut down for a period of time. Then the courts came back with a vengeance, and not only did they come back with a vengeance, they had ARPA funds and other dollars to hire extra staff. So they were pushing people through the court system. The other thing that happened is I think COVID created a recognition that there's a lot of people who have mental health challenges. It reduced stigma. So defense attorneys and prosecutors and judges were more out to say, I think that Kevin needs an evaluation. I think there may be something else going on with Kevin. Families did that. So as a result, we've had a tremendous increase in the number of people who have been deemed incompetent but restorable. And then the second order comes to have that person come to our state hospital for restoration services. Keep in mind, I only have 641 beds, and only half of those are actually available for this population. The numbers just don't work. So it's causing the backlog in the system. So you say, well, what are you doing about it? Well, we're doing a lot. And part of that is we created a forensic work group on the Behavioral Health Reform Commission in conjunction with Chief Justice Boggs. Judge Kathleen Goslin, who's a Superior Court judge in Hall County, chaired this work group. She's been on the bench since 1987, both in state court and Superior Court. And then we had 2 other Superior Court judges, 2 state court judges, 2 probate court judges, 2 juvenile court judges, 2 prosecutors, 2 defense attorneys, and 3 of our forensic experts. And they've come up with a report. There's going to be hopefully some legislation that's going to come. This will be court-led because a lot of the problems is coming from the court side, and we need their help in fixing it. We also are looking to expand community-based restoration. There's certain individuals that are in the system that just don't need to be in jail. They can be served in the community. We also have we've piloted 5 jail in-reach pilot programs. Those are very successful so far of diverting people out of jail into community services. And we've also stood up 2 jail-based restoration programs. There's been some misinformation among some of the law enforcement community on this. I want to make it clear. This is not forcing a sheriff to keep an individual in their jail who has a mental illness. These are contracts and agreements we have with 2 sheriffs in Georgia. The Cobb County Sheriff, we have a 20-bed unit in Cobb County where the sheriff is providing a space, and we're contracted to provide the clinical services there, and they're receiving restoration services. And then we just this past week started a 14-bed facility in Chatham County in conjunction with the sheriff there. We're excited about that. We have some opportunities to expand that to some other areas. The other thing I already mentioned is Operation New Hope, and I also already mentioned expanding our forensic evaluators. And then going back to the FY25 budget, we want to just run through these items quickly. I already mentioned Operation New Hope. I already mentioned the decrease in core services and where that was coming from. The governor is also proposing an additional crisis center in Northwest Georgia. One of the things that was important, again, going back to data for me, is we know we need more beds, but I wanted to know how many beds do we need. So we did A&M came in and did a very deep dive into the bed capacity, and they identified over the next decade we needed 8 more crisis centers in the state of Georgia. That report's available online. Glad to get you a copy of it. But between now and 2025, we needed 5 more crisis centers, 3 of those in the metro Atlanta area and 1 in Northwest Georgia. So we currently have 1 under construction in Fulton County, and you see those dollars there to annualize that budget. We also have an upgrade to the one in Middle Georgia down in Dublin. Those dollars would be to annualize that, and then the one in Augusta for Serenity. And then there was a one-time add to the budget that's coming out of $825,000, and then you see the increase of $22 million. That is for the behavioral health rate study. Talked about the IDD rate study. There was also a rate study for behavioral health providers. These individuals had not received an increase in a long time, and we're going to talk a little bit about that in just a second. I mentioned to you about the crisis bed study, just some highlights from that. Again, we had 8 additional crisis centers needed over the next 10 years. What was important to me, too, is that these decisions be made non-politically, where these crisis centers go. We get a lot of push from a lot of different local individuals, but we wanted to understand where's the real need in Georgia for these to be located. But the other thing we wanted to know, how many more forensic beds do we actually need? And the study showed we needed 119 additional forensic beds. That goes directly to the sheriffs and the judges that are upset about people being stuck in their facilities. That's a statewide gap by the end of 25. And then bringing it to a close, the behavioral health rate study. Rates have not increased on the behavioral health side for providers since 2008 across the board. That's a long time. A lot of inflation, a lot of increased cost. Very difficult for us to be able to provide services to our private providers across Georgia. You can see it's about a 30% increase that this would result in. Nurses and health techs and certified peers would see wages go up around 35 to 40% with this rate study. In this budget, it's $22 million. There's a portion over in DCH's budget. DCH and our agency will work with the Appropriations Committee because some of those dollars will have to be moved from one budget to the other, but we'll work through that process. All the dollars necessary to fully implement the rate study are in the governor's proposed budget. So the next step, if you pass this budget, the next step will be for the DCH board to take this up and for it to go to CMS at the federal level, and then we will be pushing them to get this done as quickly as possible, because again, this will be a game changer for us. In closing here, just these are this is a one-time reduction of $600,000. These was some dollars for the psychiatric residential treatment facility. It was placed in the budget. It's for some temporary relief. That's been handled in a different way now. And then obviously the 330 is a statewide adjustment. And then we were able to identify Brandon Kinney, our Assistant Commissioner of Operations, is doing a good job. He's works with Jason, is over our IT department. They identified some additional savings in our IT department that we cut out of our agency's budget of just over $2 million. So I know hopefully that was fast enough, Mr. Chairman. With that, I'll be glad to answer any questions that you might have, and thank you for your time.
Thank you, Commissioner. First question is for me. At state hospitals, how many beds do we have open now? Or well, back up. Let me ask it this way. Are there any beds that we don't have open?
There's very few beds. We're running at about 95% capacity, so there's very few beds that are offline because of workforce. We occasionally have to take a couple of beds offline because of an acuity issue where you just have someone that's so violent that we have to have several beds offline. But we've been able to, by our workforce gains, be able to get back to running at full capacity.
Gotcha. That 5%, what number of beds would that 5% be if we could put you at 100?
Well, we have just around 1,000 total beds.
So you're talking about 50 beds?
Yeah, statewide.
Senator Parent.
Thank you, Mr. Chairman. Thank you so much, Commissioner Tanner, for all of your great work. Question I have is related to the forensic code working group. You mentioned legislation would be emerging. Is it possible to briefly enumerate a few more of the recommendations for us right now?
Is it possible? I'm sorry.
Yeah, to enumerate a few more of the recommendations coming out of that forensic code working group that you said was going to result in some proposed legislation?
Yeah, some of it comes around making it clear about jail-based restoration and what opportunities are available there, community-based restoration. Also creating and some of it's not going to require legislation. One of the things the court's working on is a bench card around how to review an evaluation request that comes. To give you a quick example, one of the things that we heard from Judge Goslin specifically was, she said, when I get an evaluation request, I'm pretty much just signing it. I've maybe never laid eyes on the defendant at all. So she's changed her personal practice where she's actually having a hearing, she's talking to the defendant in court, and making some additional inquiries before she orders the evaluation, because we have 67% of the individuals we evaluate are competent. So we're getting a whole lot of requests for people who are competent, and she's been able to decrease her number of orders just by changing her practices. So part of it is some best practices by the court for the court on how to do those orders. So that's a lot of it.
Mm-hmm. Senator Sims.
Thank you, Mr. Chairman. Mr. Commissioner, the first statement is, does the department have a certain protocol for allowing multiple service contracts to one individual?
Are you talking about providers?
It could be a provider, or it could be a person that does custodial work or a food vendor, any of those things.
Well, we follow under DOAS's purchasing and procurement rules. So I don't know of anything that would prohibit an individual for bidding or for more than one contract.
Thank you. And also, I'm beginning to feel that we are the stepchild of Georgia and Southwest Georgia, because again, I hear things that are going on in Chatham and Metro Atlanta, but Southwest Georgia, we're just forgotten about.
Well, we actually just completed a transport study in Southwest Georgia with 30 sheriffs, all from Southwest Georgia. We also just created a position called Deputy Assistant Commissioner of Field Operations for South Georgia. And Jennifer Dunn, who many of you know, worked for DBHDD for many years and was stolen away by the University of Georgia to run their mental health program. She's come back. Her office is going to be in Thomasville, Georgia, and her whole focus is going to be on South Georgia, and she'll be in Southwest Georgia every day. Thank you.
Senator Kirkpatrick.
Thank you, Commissioner. My question's a little bit unrelated to what you've been talking about so far, and it has to do with just if you could give us a brief update on where we are with the opioid litigation settlement.
Yes, ma'am. Great question. As you know, the opioid settlement dollars that come to Georgia, I was named as the trustee in that settlement. So we've been doing a lot of work behind the scenes, including we brought a group in to do a current status of all the resources available in Georgia, all the treatment facilities, providers. That's been completed. We also did an analysis of what do we really need to look like 18 years from now as a state, so we can create a vision document and a guardrails document for the funding opportunities that'll go out. That's been completed. We're in the process, and our hope is to have it finished by the end of March, developing a portal to be able to, this portal will be the opportunity to apply for the grants, and this portal will handle the entire process from a data gathering perspective. And our hope is by the end of March, before you leave is my goal this session, is to be able to do a major announcement about the portal's open, the website's up live, and the grant opportunities are available. So ACCG, many of you are familiar with this. If you're not, the settlement agreement requires the establishment of regional advisory councils in each region, DBHDD region of the state, plus a regional advisory council in any county over 450,000 people. But it bars me or the state from directly getting involved in that process. So the Association of County Commissioners has taken that on, and they plan to have those hopefully appointed by the end of March also. The governor has appointed the members of the statewide GOSAC advisory group, and the other members of that group are from local governments. Local communities appoint those. ACCG is also spearheading that effort, and that should be done by the end of March. So a lot of progress has been made. The state's received just over $100 million so far in settlement dollars that's in an account, and we're looking forward to the first grant opportunities being available this spring.
All right, we're going to take two more questions and then keep moving. Chair Lady Dempsey.
Thank you, Commissioner. Excuse me. I want to, excuse me, I'm going to lose my voice a second. Just to check on things, and we will do more because of time. We'll ask some more next week when we get together with our subcommittee to deal with some of the staffing updates and funding that's necessary for that. So I'll be thinking about that as well.
Okay, yes, ma'am.
But also on the IDD Diagnostic and Stabilization Unit down in Macon that you mentioned, it's so profound. Do we have full funding on that, and do you have a timeline?
Yeah, that's a good question. Timeline is it should be open January of 25.
Okay.
And we do not have the full annualized funding in the budget. I will tell you, in order to true that number up, it'd be about another 1.4 million. And then the outpatient side is also a cost of about 1.7. So those are the two numbers that would be necessary to fully open the center. Inpatient and outpatient would be the 1.4 and the 1.7.
Okay, well, we'll talk about that some next week.
Okay, thank you. Mm-hmm.
Last question, Chairman Harbison. Harbison.
Thank you, Mr. Chairman. Thank you, Commissioner, for all you do. In a way, I want to sort of piggyback on some of the comments from Senator Freddie Powell Sims regarding Southwest Georgia. You mentioned there's a study that showed 119 crisis centers needed. Does that include Columbus area, specifically Columbus and the Southwest Georgia area? And you have a lot of veterans in that mix as well who are in those circumstances sometimes. So can you give us an idea of how you're approaching that or looking at that, or if it needs it?
Yeah. The 119 is statewide inpatient beds. So that would include our hospital at Columbus, et cetera. But those are inpatient beds. From a crisis bed perspective, we need 8 additional crisis centers in the next 10 years. So they, and those would be spread out across the state. The other challenge that the report shows is that we also have to get all of our beds actually open. To the chairman's point earlier, our inpatient beds that we control at the hospital, we've been able to get those back open, but we still have a lot of our crisis centers run by our CSBs that are still offline because of workforce. A lot of that has to do with the reimbursement rates, and our hope is the behavioral health reimbursement rate study that is in this budget will help bring those beds back online. Part of the challenge in the Columbus area and the Thomasville area, et cetera, has been there's crisis beds, but some of them are offline because of workforce challenges.
Thank you, Commissioner.
Yes, sir.
Commissioner, thank you again for being here. I'm sure there's a lot of other questions folks can grab you offline as you're heading out. Thanks for being here today.
Thank you, sir.
Next up is Commissioner Russell McMurray with the Department of Community Health. Carlson, sorry. I gave you a promotion.
Thank you. Mr. Chairman, there is
Hey, Commissioner, let's let the room change out right quick here. I don't know why everybody don't want to stay and listen to you.
We'll see.
Or it may have been time for a nature break too, I don't know.
Yeah, this should be good. Thank you.
Members of the committee, before Commissioner Carlson starts up, I just want y'all to know that he has been here for the entirety of the last 2 presentations because he knows he works with everybody. They seem to control a lot of the money flow. So I appreciate you being here and hearing what the other 2 commissioners had to say. And without that, we can let Miss Chairlady Houston come on in and we'll get started. So, Commissioner Carlson, the floor is yours. If y'all get the door shut back there, please.
Thank you, Mr. Chairman, and thank you for those comments. It is a partnership, to say the least. The sister agencies, as I'll point to several times throughout the presentation, are going through quite a moment together, and we all need to rely on each other. And whatever silos may have been real or perceived over years past, they need to come down, and they are a little bit more every day just due to the interconnectivity of what we're working on. And I will say, Mr. Chairman, to your comment on Russell McMurray, there's quite a Russell caucus running around this building between Crutchfield, McMurray, Keene, Powell. And I've gotten all kind of text messages over the years, after hours, whatnot, blessing me out over a turning lane or an interchange or whatever. Just probably some of you in this room. So it's like, with all due respect, sir, you got the wrong Russell here. Anyway, hey, my name is Russell Carlson. I'm proud to serve as your commissioner for the Department of Community Health and appreciate the faith and confidence Governor Kemp had in me to appoint me to this position effective August 1st. Alongside me today is Joe Hood, our Chief Operating Officer, who just went beyond his 31-year threshold with the state. That's quite an accomplishment. I agree. I keep that kind of institutional knowledge close at all times. And I also want to thank Brian Lipton, who has been with our office for some time and currently serves as our Director of Strategic Finance. I know we're sensitive to time, so I'll move right in. I know I'm not here to deliver a speech today, but I don't think I'd be doing you a service if I just went directly to the budget line items without taking a little time to paint some context, to paint some picture around all the moving parts going on across our healthcare landscape, the state and federal level. As you alluded to, Mr. Hatchett, Chairman Hatchett, with me being here earlier this morning, that wasn't by accident. Everything we do, there's an interplay, there's a choreography, there's a sensitivity to timing. And it's more important now than ever to appreciate all these moving parts as we all contemplate matters this session. And everything I discussed today has a true budgetary impact in years past, current year, and moving forward. So everything we discuss is germane to what we're going through today. But again, me going through a lot of the items we're working on is not necessarily an exercise and saying, look how much we're working on, look at our workload. Every agency is taxed. Every agency, we just spent a lot of time with Commissioner Tanner talking about workforce, as did Commissioner Brose, and we're no different. But again, my point in going through these items, first of all, they have a budgetary impact, but secondly, is to talk about the interconnectivity of everything we're working on. Whenever you're having a discussion about these matters, you have to start with the redetermination. That was a federally mandated initiative across all 56 states and territories that was kicked into action by the Consolidated Appropriations Act of 2023. So when this took effect last spring, it set several things in motion. Two items of significance rear their heads in virtually everything we do. The federal mandate to assess the Medicaid eligibility of every member in 56 states and territories nationwide, while reducing the enhanced FMAP afforded states during the pandemic. So during the pandemic, the rolls grew, as we all know, but as soon as they turned off the PHE, they immediately started scaling down the FMAP. There was not a big runway on those enhanced funds. So the loss of enhanced FMAP, we received an extra 6.5% of federal match during the PHE, but that was phased out during the calendar year of 2023. 5% in the second quarter, 2.5% in third, and 1.5% in quarter four. So as of today, January of 2024, we're back to our initial traditional FMAP. So roughly a 72 to 66 kind of dynamic when it comes to the match. So for Georgia, that meant we have, along with our partners at DHS and DFACS, who've been great. The DFACS workers have so much, and we're very appreciative of their work on the eligibility front. For Georgia, that meant we have 14 months to evaluate all 2.8 Medicaid members in Georgia while the enhanced FMAP was phased out. We're currently a little over halfway through that exercise, and again, couldn't be done without the partnership with those DFACS caseworkers working with these families on the front line. So these factors result in a dynamic to where you begin to see a decreased enrollment in LIM and low-income Medicaid due to the reevaluation of all members and the redetermination, but running simultaneously to that, a dynamic you're all familiar with, increased health care costs and increased utilization. Now, the increased utilization obviously is not a bad thing, especially considering that our data suggests much of that increased utilization has been in the space of mental and behavioral health. So people are addressing their needs and going to providers. But one item I do want to point out here in that act is of importance to a lot of agencies and yourselves is 12 months of continuous eligibility for children under 19. What that means is everybody's evaluated on their anniversary date, their renewal date, but regardless of circumstances, within that 12 months, your status is not disturbed. So it's an underlying stability, predictability. It allows children to get necessary screenings and services. The EPSDT, which we discuss a lot, that is very wellness-driven benefits, dental, vision, even behavioral and cognitive screenings, diagnostics. So that 12-month continuous eligibility is a policy that I think will serve us well. But also that went away with the PHE was a loss of several flexibilities that we're always having to reconcile. You could do this during the PHE. How do we continue it or not now that the PHE is over? And then obviously, again, interplay, convergence of several initiatives at once, systems dynamics, the Pathways to Coverage program that we're all familiar with, launched on July 1st of this year. Obviously, for those of you that don't know, it's a new initiative that allows Georgians to qualify for Medicaid who would otherwise not be eligible for traditional Medicaid, ages 19 to 64, and it calls for individuals to complete at least 80 hours of qualifying activities and be no more than 100% of the federal poverty level. The qualifying activities you may have heard about can include full or part-time employment, job readiness programs, community service, higher education, and some of the vocational rehabilitation available at GVRA. Again, sensitive to time, I've mentioned the healthcare costs rising, the utilization, the annual update of nursing home cost reports, which you'll see in the amended budget. And then here's another item, again, the interplay that I'd like to point out. CMS has a pending Medicaid managed care rule that has a lot of different dynamics, but a couple things come to mind given the deliberations here at the Capitol this year and in years past. For example, this program, if passed as written, would put a cap on DPP programs, the directed payment programs, which we're all familiar with. Those programs, all of which have been renewed, approved by CMS, debated and discussed last session, have about $1.3 billion new dollars going into hospital systems across the state. But should that rule pass, that would put a cap on those programs. So that's just something to be mindful as we debate. It's up for annual renewal. So should you consider changing the programs, new people in, new people out, changing criteria or methodology, we have to be aware of the impact, the financial impact on that program and how it may or may not be caught up in this conversation. And then the CMO procurement. In these interesting times, it's amazing that this procurement, the largest procurement the state has, and as significant a health policy statement as you'll see in the state, this is going on simultaneously to everything else. And so we have done a really good job in the department of trying to set criteria as we are now in the evaluation stage of these RFPs to really sequester people involved with this, have subject matter experts that put them in a position where they're not necessarily caught up in the day-to-day of the affairs of the department, of which there are many, but try to give it the attention due because it is such an immense undertaking, such an important undertaking, and one that we're proud of. We're proud of the way the RFP kind of challenged us to balance quality, innovation, and accountability. So it's something that is going on, and in other circumstances, it would be the only act in town as far as DCH. But here it is caught up in these unique circumstances. Again, I don't have to go through all of these, but these all have budgetary impacts, legislative impacts that have been discussed in this room in years past, and show up in so many things. They impact not only the 24 and 25 budgets, but they also have impact past budgets and future budgets. Real quick, the DPP programs, which we alluded to, again, all of these programs for FY 2024 have been approved by CMS. Some dollars are already going out. We expect interim payments to continue going out through the winter in the next 4 to 6 weeks. Of interest to this committee in years past, and has been funded, and Chairman Dempsey, to your conversation earlier on data and the dynamics around that, the EASE project. This is something that's been funded by this body over the years. Essentially, this is a cloud-based modernization effort to have better command and control over Medicaid data. Autonomy is a key word to remember here. How can we get command of the data, clean the data, assess the data, and make decisions around our own table at the state of Georgia, and create and continue to create a culture of data-based decision-making so we know what we're looking at. And hopefully a lot of times when we're working with CMOs and others, we know the answers to questions before we ask them. We have a clear snapshot of what's going on in our own state, and that's something we're very proud of. Moving through these, this is a reimbursement system, a change in methodology across all hospital providers that we have worked through in transparency in conjunction with hospitals, so it got to a place where we could all be comfortable. Again, a program that is very important to this committee, and rightfully so, GME programs and the rural stabilization grants based out of our office in Cordele, the Office of Rural Health. I want to thank this body and the governor for continuing to support these opportunities. Last year's budget also included 4 $1 million grant opportunities for hospitals with GME programs. These opportunities are currently open and under review. We're pleased in the spirit of participation and interest. There were over 32 applicants between both of these programs, the GME and the Rural Stabilization Grant. That's the most interest. That's the most applications we've ever gotten. So I think that's a good statement for the brand, if you will, and how hospital systems take note of these programs. As far as the evaluation timeframes, track 1 was the hospital stabilization, track 2 was the GME program. So we're currently going to score track 2 first, the GME program, and we expect those awards to be given out later this month, and then we'll promptly transition to track 1, which is the stabilization grants. We hope that's out in February. PRTFs, I know Commissioner Brose and others have discussed this program. This was debated last year, and it was a budget item in the budget last year. We worked with a lot of our sister agencies in this body to try and find creative ways to bring more Georgia beds for Georgia children online. Again, previous conversation with Commissioner Tanner, you're talking about what capacity exists, but due to staffing and whatnot, are just left online. As we all talk about building out capacities, how do we activate what capacity we already have? And this was a creative idea that many people in this room took part in. It was to bring the rates up to 75% of Medicare for facilities, providers that saw a significant number of Georgia beds. We put a number at 10,000 Medicaid days for Georgians. I want to be clear, this is still pending at CMS, but there is a conversation going on. They're asking questions. We're giving answers. This would bring the rate up to about $650. That would be really second only to California. For those of you not familiar with PRTF, the out-of-state conversation, moving people out of state, paying people out of state, it's very much where families were sending their kids out of state due to capacity or costs. So this tries, it's almost an economic development conversation to make these Georgia beds more attractive and do our best to keep them close to home. Again, the never-ending conversation about access in rural areas. We were able to increase, allow for Medicaid reimbursement services for counselors and FQHCs. Another budgetary item that we're working on, and I think you'll see legislation contemplated before you this year that I know Commissioner Brose alluded to earlier, is the new QRTP designation. Again, just a different set of services than a PRTF, but also kind of a step down, if you will, and is a good place in the referral spectrum that we thought Georgia could use a new designation. Children with serious emotional and behavioral disorders, and there's significant federal dollars available. So we saw an initiative along with DHS, really a driver in this, to allow DHS to take advantage of these good federal dollars and create this new designation. But that will be an item contemplated before you this session, and we'll be supporting DHS in this effort. PACE programs, an interesting new product in long-term care, not new, but it would be new to Georgia. It will be contemplated in legislation also. It was something you asked us to review and study in last year's budget, and the interest and the traction was so robust that we believe it's something that we could move forward with as a true designation. So that study you asked us to do is proving fruitful. It's almost a public-private partnership that would reduce the cost of nursing home care, hospitalizations, and other medical expenses. And what's unique about this, and again, it'll be debated in this body, is there's a pathway to have significant Medicare dollars paying for these services, up to about 50%, I believe, in some of these spaces, so stretching the state dollar. And again, in long-term care, the conversation is always how do we enhance the community-based offerings, and this is one of those. So in the community, federal funds attached, and just a creative new program that we're excited about debating. I recognize that Dr. Toomey will be behind me, and I know this is something that we've worked tirelessly with her on. I really want to commend Dr. Burke, whose background in rural population health continues to reap dividends. Fetal monitoring, which Senator Walker, I know you were involved in, another legislative initiative that DPH and the CMOs are executing a new home visitation and remote monitoring program. It's a concept that's actually spoken to several times in the CMO RFP, as maternal health was one of the three kind of pillars in our mind of the CMO RFP effort. The other two being behavioral health issues and chronic disease management. Those are the three items that we kind of, all of our work groups had on their mind as they discussed that. So we're hoping some innovation presents itself there, but we're glad to support DPH in that important issue. There's also an effort to coverage, when medically necessary, a very narrow definition of covering some degree of blood pressure monitors, again, for chronic disease management. We were able to, per the budget, it was and it'll present itself later in the budget presentation, increase codes, reimbursement rates for several essential developmental and behavioral screening and testing. Obviously, autism on the mind there, a very good policy that should hopefully get kids screened earlier. Again, back to the continuous eligibility comments earlier too, that more people have access to these services on both fronts. I skipped over this, and I'm sorry I did. The EMS treatment without transport, this is another example of just trying to entertain any idea that comes through. There are some members in this room that had asked us about treatment without transport. What that is incentivizing EMS providers to use telehealth and to do very responsible assessments on site when they go out to a call to assess if these individuals need to proceed to the ER. Again, as long as we've been having healthcare kind of cost savings discussions, ER deterrence is such a vital part of that. And this is embracing a new technology that will give EMS providers an enhanced rate for embracing this technology. And it's something that we will be able to measure and evaluate, and we hope there are benefits in the ER deterrence associated with that, which obviously goes into wall times, response times, and everything else. Moving kind of back to that, there is a upper payment limit approved for ambulance providers, again, shoring up the EMS system. A new licensure category for adult residential mental health programs. There's a provisional license in the field, and we're still working with stakeholders to get a final rule that will provide more access in this space. And then something I know that's been discussed here as new technology, new science presents itself, coverage for biomarker testing and rapid whole genome sequencing. Basically, critically ill patients in intensive care will have access to some of these new technologies and sciences, quicker diagnosis for certain ailments and conditions, respiratory, cardiovascular problems, seizures, and brain disorders. The biomarker piece can even identify certain cancers, but that's narrowly drawn for a smaller population of intensive care kind of settings to make sure that we're being responsible when we open up conversation like that. So again, sensitive time, I wanted to demonstrate the context, the environment that we're working in, a lot of the items that you have asked us to work on. I wanted to demonstrate that. But again, as we look strategically, again, these are things that you have budgeted us for and asked us, you've invested immensely in. There's an old saying, you know, how can we be nearsighted and farsighted at the same time? Take care of the people's business today, but keep an eye on the way ahead. This is an eye chart kind of slide, so I'm not going to go through in detail. This is the way ahead. This is all the systems that are currently underway and being basically that are driving your Medicaid, your DCH program. Gateway, for example, and I should point out, every red and green, and I apologize for using red and green, that is not necessarily a status, not going well, going poorly. But everything in red and green is either under procurement now or scheduled to be in flight. So as you can see, there are immense systems overhauls that you've invested in that are going on behind the curtain as we all try to do our day-to-day jobs. And again, keeping with that interplay dynamic, Gateway, that's our eligibility system. That's basically the backbone of the Medicaid redetermination conversation. And a lot of pieces of that have been up for reprocurement. So how do you balance looking forward and responsibly being prepared for that, but not undermining the system we have now that's very valuable, and we value the partnership with these guys. Excuse me. How do we keep the steady state appropriate to execute on redetermination and things like that while keeping one eye on the way ahead that you have asked us to entertain? So again, but a lot of this claim systems, case management for the surveyors that survey over 30,000 facilities. How do they keep these things in check? So anything you can imagine is reflected here. And again, just keeping with the theme of interplay and how these pieces all connect to one another. And then the last, keeping with the spirit of people pointing out workforce, one of our biggest challenge is we're trying to accomplish all this and this with an agency that is 1/3 retirement eligible in the next 2 to 5 years. And within Medicaid division specifically, that number grows closer to about 45%. So obviously, I spend a lot of time on the recruiting trail and trying to fill these vacancies. I think we're at about 17% vacancies now. And so we're trying to fill out our rosters. And I'm very pleased with that. You'll have announcements soon. We promoted our longtime Medicaid director, Lynette Rhodes, a huge asset to the team. We promoted her to Chief Health Policy Officer, so we're now going to hire a new Medicaid director for the state, someone with a lot of experience in D.C. with a good interface with CMS. I think they'll be a big asset. And we do have a new hire, the State Office of Rural Health, a new director that'll be coming in there, and we're excited about that opportunity. But moving to the budget proper, this is a slide I believe you've seen earlier in years past. It's just a demonstration of the general dynamics of our benefits. Again, nothing new here as far as the trends that ABD and low-income Medicaid always make the bulk of the state funds expended. And here's the total funds, again, for 24 going through this. Obviously, SHBP is represented here now as well. And so a dynamic you'll continue to see as we work through these. Let's go through these slides first. I've alluded to several of these. The increased behavioral health screening and testing with autism, including that, and then remove funds for 5-year waiting period, remove the 5-year waiting period for pregnant women and children who are lawful permanent residents. These are the items being executed from last year's budget here in the amended. And moving forward to the actual recommendations. Sorry, I know I'm trying to be sensitive to time. Let me demonstrate this item here. So this is what we're going to see throughout slides. A reduction in limb. And that is obviously is related to the redetermination effort and fluctuations in enrollment. Okay. Programmatic changes for all the workforce comments I made and the retirement eligibility that I mentioned. I can't thank the governor, OPB, and this body for the $1,000 supplement in December and all the proposals moving forward that we'll discuss. This was transferring funds to Peach Care out of efficiencies elsewhere to help with claims in that space. Some of the yes items. Okay, let's go to the benefits package. Okay, again, where things rear their head as far as what's going on. ABD, obviously there's tremendous growth due to utilization and the acuity of that population. But low-income Medicaid, again, with the redetermination effort, that's where you see the changes in enrollment manifesting themselves. Medicare buy-in Part B and Part D are things that you see every year, and we actually have some in your packet for takeaways, really getting into the details of the calculations with those. Those are federal programs, but we wanted you to have that visibility. The reason here in an amended budget that the nursing home cost report is a larger number is in the original 2024 budget, that was a yes item. So essentially here, this line item in the amended budget is funding that policy. And provider fees that you're accustomed to seeing, the provider fee, as we all know, is set to expire, and there'll be legislation contemplated before you this year to renew that for a significant period of time. That now has potentially a $2 billion impact when you consider that DPP programs and other things of that nature are tied to it. And now we'll move to the 2025 budget, again, kind of keeping with the same scheme that you've seen earlier. All right. Let me point out this. The reduction here represents the $4 million we executed in the GME projects. So those are one-time funds being executed. So that's the reason for the reduction there. Okay, let me go to the benefits, the programmatic changes. Here are a lot of the statewide changes, DOAS, GBA, GTA, TRS changes. I would like to point your attention, because it is new, when OPB granted us the opportunity in August to work on things that we would like to see. We have proposed, and we're very grateful for Director Dunn and the Governor's support of 20 positions as we, again, prepare for the new CMO contracts. All those systems overhauls we're talking about, all of it is centered around data, new systems, having the right analytics to be predictive when we can, to point out anomalies where we see them, and again, just sticking with that theme of knowing the answers to questions wherever we see them, knowing the answer to question before we ask them. And so those are all related to the more robust CMO oversight that we're working on. Again, I'll commit to you, as a department, we recognize that over the years, there's always been the desire to see this department hold CMOs more accountable and to have more of a enforcement capability. This data will help us do that, and working with the CMOs, our partners, to have a good discussion about what is or isn't happening in the field and how to catch problems before they arise. Again, when I see the new RFPs go out, I don't necessarily think about, look at what we're asking as a department, as a state, look at what we're asking the CMOs to do. I read that and I think, look at all the new things we're asking the department to do. There's a lot of responsibility in this exercise that's ultimately coming back on us to execute on these, and so we're asking for that investment. We're also asked to find efficiencies for a reduction, and we have done so in one of our other enterprise technology transitions. And again, this is another point I'd like to point out that's very important to you, investing in our surveyors. Our surveyors are obviously the backbone of our entire regulatory responsibilities. They survey over 30,000 facilities. There's always a little bit of turnover in those, but we are investing them to bring them up to par with where we think. It basically, along with the COLA, it would basically amount to an average of a $4,600 raise for these surveyors, which we think would be a tremendous in recruitment and retention. Here's a detailed assessment of the performance management, the data analytics as far as CMOs that I mentioned. Again, knowing for the takeaway, here's how we've estimated the roles we'll need and a salary to be competitive yet responsible. And here's further detail on the surveyor's request. Again, moving to benefits, I always try to state that 97% of our budget is benefits, programmatic in nature. Here's the age blind disabled growth, and again, the reduction in low-income Medicaid that represents the fluctuations in enrollment. This is something I'd like to point out. The FMAP restoration, a little bit different line item. So again, it goes back to the push and pull between several years of enhanced FMAP, a total of $273 million across all three programs to reflect the end of the enhanced FMAP that was realized in past budgets. But this, to make sure I point out the difference, this is the restoration, kind of truing up years of enhanced FMAP. This is your traditional FMAP adjustment that takes into account income levels and population. This is rebasing the nursing home cost report to the newest audited year, 2022. Again, provider fee statements that you're used to. And then what Commissioner Tanner alluded to, we have worked very much with his department and stakeholders to execute on the provider studies across all these waiver programs and do so responsibly and in coordination with OPB, taking into account ARPA funds that were expiring and things of that nature. Again, nuanced, choreographed, timing. It's something we all worked hard on, and we're grateful for that. Here's a more detailed, again, with the rate studies, SB 610, calling us to do these, and again, working with the departments involved. We've been able to come to a good place and working on those. Again, there's cost sharing between us and DBHGD. And for your purposes, and I'll be honest with you, also mine, we've put in always can use a refresher on these nuanced waiver programs and the populations we serve. There's a time when I worked at the National Guard as a civilian. I was a general once. And I would always say, I went home one night to my wife and said, these people use acronyms to explain their acronyms. And I know healthcare can get that way too. So always good to have that as a little bit of cheat sheet, quarterback wristband, if you will. Moving on to SHBP. Here's current state. Okay, this is something that last year the General Assembly voted to increase the PMPM for certified school personnel from $940 to $1,580 starting January 1st. This helped the projected deficit in FY23 and will keep revenue greater than expenditures in 2024, throughout 24. However, our actuaries are projecting a deficit on the school side to start again as early as 2025. And the governor's recommendation, we're very appreciative for this. The recommendation includes language, it includes language to increase the PMPM on certified staff to $1,760 effective July 1st. And the updated projection has revenue again exceeding expense in 2025. So again, the interplay between these two slides, it helps shore up the plan in that sense as we weigh out growth and revenue. Medicaid redeterminations, I'll say this is outside the budget process, but I know some of you may be familiar. There was ARPA funding available. This is tremendous. This is what I consider the tide that lifts all boats, from staff augmentation to changing process, more automation. I think this investment that the governor and OPB were just so kind to entertain and see through, it will help us with redeterminations. It also helps with SNAP and TANF renewals. It helps with whether it's any program that is before the eligibility worker, not to mention the world is still spinning, right? You still have new applicants. And this, again, is the tide that lifts all boats that will hopefully help us see our way through this season. And these are technologies, investments that don't necessarily go away the day the PHE ends. And so hopefully we'll come out, again, with our partners at DFACS and our DCH team as more efficient in all eligibility conversations. As always, Brandy Sylvan and Caitlin Ward do so much for us during the legislative session, but I think you all have leaned on them throughout the year on your constituent efforts, and I'm very grateful for all they do year-round. So, Mr. Chairman, I know that's a lot,
Commissioner,
but it's a lot.
Commissioner, I think everybody's kind of in a state of shock or something, but you did finally get a couple of questions, but Chairman Tillery asked me if he said he had a question about the freight logistics study. Chairman Tillery?
I'm going to have to get back with you on that one, Mr. Chairman.
He said something about I-16. Anyway. Chairman Hawkins.
Thank you, Mr. Chairman. There was talk earlier in the year about moving ABD to CMOs. Is that still on track? I didn't notice that in any of the presentation.
Yes, sir. So the CMO RFP that is before us does transition certain components of ABD over a period of time. But I've thought about how I wanted to speak to that, and I think the best way I can answer that, Mr. Chairman, is first of all tell you what is not moving to managed care. What is not moving to managed care are individuals involved in the sensitive IDD programs like Now and Comp, not moving to managed care. Children that are medically fragile, like our Katie Beckett program, those are not moving. Hospice is not moving.
Good.
There will be, and even the populations that will eventually be contemplated more in the, as they say, LTSS, long-term supports and services, nursing home care, home and community-based, even those that are considered to move later are phased in. As written now, it's year 3, but the department reserves the right to extend that if need be. But it's to give everyone, the states that have done this right have given everyone the runway to have that discussion between the CMOs, the providers, to make sure we all have a responsible network whenever the transition happens.
So we're going to increase revenues to the CMOs?
Sir?
We're going to increase the budget to cover the cost of the CMOs. We're going to take that out of the reimbursement to the providers.
So that will just remain seen as we award winners and negotiate contracts. I guess we'll all have to work on our projections and actuaries to assess where in subsequent budgets we're recognizing savings or not. So
we'll be watching that.
Yes, sir.
Thank you.
I understand.
Good question, Chairman Hawkins. Senator Lucas. You don't have your, Senator Walker, excuse me.
Thank you, Mr. Chairman. Great presentation, Commissioner, and I appreciate all the hard work of your agency making great progress. What is, it may have been on the slide, but I couldn't see it. What's our FMAP percentage now?
66% flat. Yes, 66%.
So it's gone up a little bit, it sounds like, maybe. I thought it was around 62, but.
No, sir. I believe that's kind of where it landed after all the enhanced phase out.
Okay.
Yes, sir.
Could I ask another question, Mr. Chairman, or make a statement? On the managed care, the shift to managed care, one of my big concerns is the CMOs that we have now sometimes run really roughshod over the providers and seem to create their own set of rules and pay what they want to and don't pay other things. I hope you all will be real insistent and strategic in holding these CMOs accountable, because we already have a lack of providers, and we don't need to drive more of them out of business.
Yes, sir. I can appreciate that. The stability of the network is of great interest to us all. Again, On the accountability side, this entire RFP process, I feel a burden on us to execute. I don't feel like I'm asking, the CMOs to do this, that, and the other. I feel a great deal of responsibility to deliver on how we manage this moving forward.
Thank you very much.
Yes, sir.
Commissioner, aren't you proposing a group to monitor CMOs more closely?
Yes, sir. That is essentially our budget quest, to have a kind of a standalone division, if you will, that just is forward-facing to the CMOs all day, every day.
Representative Holcomb.
Thank you, Mr. Chairman. Thank you, Mr. Chairman. Commissioner Carlson, I want to ask about Georgia Pathways. I think last year we budgeted approximately $117 million, and there was an expectation of an enrollment of around 60,000 in the first year. And my understanding is that numbers are significantly below that, and that less than 2,500 people had signed up by the end of 2023 calendar year. What are the factors that are leading to this very low engagement? Is it not known? Is the application process difficult? Can you shine some light on what's happening? Because
yes, sir. Of course. Obviously, I'm fully aware of those trends and the enrollment that is approximately 3,000 by now. I think there are a lot of dynamics in place. As you know, right now, Pathways, that discussion has been kind of with redetermination as we all assess these families and where the best landing spot is. I do think you have some dynamics at play as far as our projections. We have found the data suggests that a good number of people in redeterminations have called up, been determined eligible for traditional Medicaid on the determination on the backside of redeterminations, if you will. But also, I think there's something to be said for General Keene and the Georgia Access, the exchange process. We are finding that a lot of people in this 100 to 138% are landing on the exchange. I believe, as robust as 650,000 individuals are landing there as well. And as far as your outreach, we are, again, a little bit past the halfway point of redeterminations. We are trying to double down on our outreach for Pathways specifically through obviously some technology enhancements, but also working with, for example, we have an event with GVRA coming up soon. We think that's a population that would have a lot of synergy. We're having an enrollment event with them soon and walking them the program. Obviously a lot in the educational spaces. We're trying to do more. So I know we have more outreach and education that we can be doing. But I do think, to your observation, I think you're right. I think a lot of this has been caught up just in the redetermination. And I think that it is good when I look at Georgia Access, Pathways. I think people, as they go through the redeterminations process, are blessed with a few options, and I hope all the families find the landing spot that's proper for them. So.
Thanks. Mr. Chairman, can I ask one other question, different topic? The DPPs, my understanding is that one of the pilot programs that you all have with Grady and Augusta is that it's working quite well. Can you shed a little bit of light on that, and is there a plan to potentially roll it out beyond that?
So I guess you're probably referring to within the DPP program. I believe Georgia Aid would be the program that is. That I'm glad you brought that up, because with these programs, obviously the federal government has so much skin in the game. They ask a lot of us. For example, with Georgia Aid, the program you're referring to, 10% of the total payment is at risk based on performance-based metrics, preventative care, and a lot of health outcomes. So it's a metric. There's 10 evaluation measures associated with that. So far, and judging by the fact that CMS did recently approve for FY 2024, I think it's moving along well, and I know Dr. Burke and his population health background appreciates that it is performance driven. So I'm very encouraged thus far. Yes, sir. Thank you.
Commissioner, I get the last question again. The question I have is about some of the disregards in the HB 19. As you know, there are a lot of legislative ads that were disregarded. It looks like some of those funds were held in 24, maybe appear again in 25. That's just my question is, I'm going to run through a few of them, like the lupus education monies, the increases for dental services, the EMS reimbursement rates, the home and community-based service providers, the GAP provider increases, the monies to fill low-volume pharmacies. the speech and pathology ads, the OT-PT ads. It looks like those monies stay in 25, psychology, the OBGYN codes. Is it the intention of the agency to do those codes, or are those monies just baked into the base now for
I think
future
they're in
years?
the base, awaiting further direction on execution
Okay.
with the appropriations process.
Thanks.
Yes, sir.
Thank you, Commissioner.
Yes, sir. Thank you. Thank you.
No. Are you freezing? Are you keeping it cold? Okay. Next up is Commissioner Kathleen Toomey with the Department of Public Health.
Yeah, I'll do it. Okay, we're good. About that. I'll do it right here.
All right, hey, well, calm down. I tell you what, Dr. Toomey, these people get rowdy once they break up for a minute.
I think they won't be quite as excited when they hear about some of the things I'll talk about. But,
All right, y'all. Thank you. Dr. Toomey, welcome, and the floor is yours.
Oh, thank you. Thank you so much. Chairman Hatchett, Tillery is, I don't see him, but he'll be coming back. All the other fellow chairmen who are on the dais, as well as the General Assembly members who are here. I want to thank you all for the invitation to be here and to talk about the budget. I do want to acknowledge, in particular, a couple of my staff. You know what it is? It's so cold out. Everybody's trying to warm up. I think that's what's going on here. It's Will Bell, who's our CFO, who's been just extraordinarily helpful. And of course, Megan Andrews, who's our Assistant Commissioner for Policy and has been quite instrumental in developing our budget. I also want to acknowledge my 4 commissioner colleagues who have already presented today. Because they have really been working with us very, very closely. We worked with DFACS, we worked with the DCH on many of our initiatives. We've also been working with Commissioner Tanner, particularly in the area of maternal mortality and linkage to mental health services in children. And so I think what has happened is that we have a convergence of opportunity across the 4 health agencies, and I really appreciate their support as well this year. So let me launch into our presentation and start off with what a nice picture that I think you've heard from me almost every year, and that's the unusual structure of public health in Georgia. We have 1 state office, but 18 public health districts overseen by a district health director who's a state employee who reports to me, at 159 county health departments. That's really quite unusual. I think only Texas has more counties than we do, and it's certainly a challenge for management at a time when we have a pandemic, but also a challenge because the boards of health are not reporting to the state, and so we have to have a very strong, persuasive authority to be able to get uniformity across the districts. And I know this has been a challenge for many of you in this room, particularly for those who are small businessmen or may have restaurants where a restaurant in one location may have slightly different rules when the inspectors come in one county versus another, or even septic tanks, which have been the bane of my existence over the last 5 years. But I think these are some of the things that we are constantly working on to ensure uniformity and consistency. If you look at our budget, it also is kind of unusual compared to many of the other agencies. Almost half of our of our budget is federally funded, which means that we are looking forward to seeing what happens with that federal budget, because some of our state programs, particularly things like WIC, which serve women, infant, and children nutrition program, are fully federally funded. And so we really have to watch that carefully, because half of our total budget is coming from the feds. But the other half, the state funding, half of that goes as grant and aid to the counties. And so very small proportion of our state budget goes to staff at the state level. And I think that's worth saying, is that we really send out those funds largely to the districts and counties, who are our partners in being able to ensure the health at the local level. I want to acknowledge and thank upfront the governor's support for us in the budget. It was really one of the best budgets I have ever been able to present, and we were very, very happy, most particularly with the salary supplement for this year, as well as the statewide changes, because this will make a big difference. Since COVID, we are still fighting the workforce challenges for recruitment and retention. And for us, retention is particularly a challenge. And so when you look at the governor's recommendations, both for the statewide as well as the both 24 and 25, these will really be very, very beneficial for us to be able to ensure our workforce remains in place. But the other thing I want to point out is that 80% of the salary supplement goes out to the counties. And so actually, again, it's not retained at the state office for state office staff. It's providing 4,300 county employees that additional benefit. And so only 20% is staying at the state office. And so the point I'm trying to make over these last two slides is the fact that we are really working in partnership with the districts and counties, and extremely important for us to be effective at our work. If we can move forward to the 2024 budget, I wanted to go through each item. Many of them will be repeated in 2025. I won't go back over the explanation, but I think you'll see that, again, it addressed many of our concerns that we were looking forward to getting resolved. One of the most important things from our perspective, and I think for many of you in the room, was the restoration of funds for the Clayton County District Health Director. And I'm looking at some of the Clayton delegation. I know that that was not a positive move when we had proposed consolidating Clayton into another district. It was to improve efficiency and effectiveness, and what in fact it did was create a lot of uncertainty and inability to actually manage well, and not able to address the real problems that Clayton County has. And so I'm really pleased that we have now solid funds for that health director position. And so thank you to you in the audience who enlightened me on the importance of that. So moving on, you'll see that there's a number of transfers of funds from our existing budget to fund other priorities, and we are very pleased to see that occurred. One of these includes, if you look and again, these are all staying in the budget, so you're not seeing an increase in our budget per se, but a transfer of funds from other programs. And I want to point out in particular the prescription drug monitoring program. For those of you in the audience, you may recall the prescription drug monitoring program is a state mandated program. It is both federally and state funded. And every physician, including myself, has to enroll in the PDMP, and it monitors not only our behavior, what are we prescribing and who's overprescribing opioids, but also the many million patients who may be receiving narcotic drugs or controlled drugs, and so to ensure that that our patients are not abusing them or doctor shopping. And I think what has been really interesting is that as we're seeing the emergence of fentanyl and synthetic opioids, we realize that the PDMP has done a great job. I think physicians are very, very aware of their own prescribing patterns, in part because we get those reports back. I get that report back, although all that's on my report is naloxone, which is a good thing. But I think the most important thing is it's federally and state funded, and the entire federal funds to support that. Many of them were cut. I mean, it was cut during the COVID rescission. And so we had to, in order to continue this mandated program, we had to get some additional state dollars to shore up that budget. This is not paying for staff, it's paying for consolidating that software system that we all enroll in. And I think this is a very good and strong use of state dollars. The other thing that we wanted to point out is the epidemiology position for the low THC program. Many of you are aware of the low THC program and supported that program. I think I've become much more aware as I've taken on, over the last several years, taken on this role, the potential value of that program, but also saw that the data that were being collected were not really kind of consistently analyzed in a way that would allow us to know who was prescribing, how many patients do we have, and particularly not giving the data back to the distributors or the Cannabis Commission to ensure that they were aware of the needs for additional dispensaries across the state. I actually assigned several of my best epidemiologists from COVID to go work on that, and we were able to really get an ongoing systematic analysis of these data in a really positive way, so we can do that on a regular basis with updates. But having done so, we need to maintain that. It can't be just analyze it today and then they go back to their regular jobs. They have full-time jobs. And so we asked for a position, a full-time position for the low THC program. And that is included both in the 2024 and continued over into 2025. And the final thing is that some of you may be, I'm trying to see if I don't recognize, but some of you may be in the funeral industry, and I know there are physicians in the audience. There were some real challenges that I'd heard about from the Gavers program, and that was the death certificate recording system, kind of cumbersome software. It was very hard to enter, it delayed entry, and that death certificate is so critical to families, and if to be able to proceed with the funerals, et cetera. This was an efficiency for the program that we saw very, very positive. It's one time only, and it updates that system, and so I was very pleased to see that in our budget. Two things that are being cut in 2025 because of efficiency, so not really cut, they're reduced, but because they weren't needed, it could be redirected elsewhere in our budget. Eliminate one-time funds for lead inspection, startup costs, and testing machines. We have hired lead inspectors, we've hired the equipment, we realized we didn't need additional equipment, we have them in place, they are doing their job. We could roll that back into programs for other essential priorities. And last but not least, you'll see some reduction for the telehealth equipment. If anything, telehealth is more important to us now, particularly as we're looking at issues like maternal mortality. But the telehealth equipment was not needed right now. We did a very good analysis of the equipment we have and an inventory. We found that we actually had extra equipment that was not needed, so we didn't need to buy new equipment. And so this, again, was efficient and effective use of state dollars that we could roll back into the program. Quickly going on to 2025, I just want to go over the new items. Again, the full funding for the Clayton, the other issues as we already discussed. But I do want to also note the 1.741 and a little more money for the warehouse. The warehouse is the emergency preparedness warehouse. That's the warehouse where ventilators were stored. That's where PPE was stored during COVID. We have pharmaceutical products, including Tamiflu and COVID treatments. We have many other items in there, and they're being used by GMA as well as our agency and sometimes the National Guard. So this warehouse facility, it's very large. It serves 3 separate agencies. And it, again, was fully federally funded with COVID dollars. It's absolutely essential to our response, not just for things like COVID or even influenza, which is, we're using it now, but also we have naloxone stored there. We used that when we helped the Secretary of State's office when he had those letters that were potentially fentanyl contaminated. So this is a warehouse that crosses agency lines, and as a statewide resource, it deserved full funding after those COVID funds are going away. And so this is happily will restore a full funding, but state funding for that, so it can go on. You'll see that we use this warehouse when there is a hurricane or some other emergency event. So it's something that we frequently rely on. And for those of you who really have an interest in this area, we'd love to take you on a tour, but it's really quite impressive. Again, physician drug monitoring program. And I want to move on to a few other items which were not talked about previously. One is to increase the funding for 2 additional newborn screening disorders. And I'm doing this on purpose. I skipped one, so I just want you to know I'm doing it on purpose, is newborn screening disorders. The newborn screening is one of our most important programs. It funds every child at birth. I mean, it touches every child at birth because every child is tested at birth. And we actually use not only recommendations from CDC, but also a committee that looks at this and makes recommendations for what we are going to test, because the tests are really important because they identify treatable conditions that we could be aware of and provide treatment for that newborn and to prevent preventable deaths. And so that was 2 additional disorders have been recommended, and this will expand the additional disorders. But this really feeds into as well what I skipped over, and that's the expansion of our maternal mortality prevention program. Perhaps the most important item that I see on this budget is the home visiting program. Maternal mortality prevention, in my mind, goes in partnership with infant mortality and morbidity prevention. How can you separate out mothers and babies? I mean, healthy mothers and healthy babies go together, and you can't have one without the other. And so I see it as a continuum. And the home visiting program was something that was initially funded last year by about $1.7 million to identify at-risk, high-risk mothers to be able to provide medical services, also identify social problems as well as mental health issues that the community health worker who's from the community and trained, interacting with a nurse, and then potentially even through telehealth with hospitals nearby, to provide the care that they need for that healthy pregnancy, even beyond pregnancy into the first year of that child's life. Already these workers have found substance abuse issues as well as mental health issues, as well as serious hypertension and other potentially treatable health conditions that we can help that woman, including by providing transportation and other access to the needed services. So the fact that this was, you can't tell because again, this was direction of transfer of funds from another program, but this will add another $1 million to that program. And so we're going for what is a current 21 counties in high-risk counties in rural Georgia, North and South Georgia, to an additional 13 counties. And so we are very pleased to see that addition. I think this is the cornerstone of what can be our maternal mortality prevention, because it's addressing all the issues that you've heard about from Commissioner Brost to Commissioner Tanner to Commissioner Carlson. We can help women enroll to Medicaid. We've found mothers who didn't know they could get access to SNAP and WIC. And so this is kind of one stop at a time when they themselves may not be able to get out of the house because of other children in the house. We are so excited about this, and I have to say the excitement across the counties is shared because they're seeing that this can make such a difference. And what we have all seen as an extraordinarily important problem, but yet have not seen us move, the statistics for many years. Because believe me, when I was here years ago, this was a problem then, it's still a problem now, but this is really, hitting that problem head on. And I believe it will make a big difference. And so I really am grateful to see that addition to that program and expansion. The next and final topic, which kind of goes with that, is not something that I think many of you feel comfortable talking about, and that's syphilis. This is not something we generally talk about in this room, and yet it's something of terrific concern to us here in Georgia because of its impact, not only on many populations in Georgia, but because of its impact on the outcomes of mothers and babies. Georgia has one of the highest rates of syphilis in the nation, but we are not unique. Many states have high rates of syphilis right now, including other places in the South, other places in the Midwest, and even New Mexico. But we also have high rates of congenital syphilis. Remember, syphilis is a sexually transmitted infection, but it is absolutely treatable. It is not like HIV. You can treat HIV, but that virus will remain, and you have to be treated for life. Syphilis can be treated with penicillin, a drug that's been widely available since the 1940s, and yet we have, as we've seen, an increase in women acquiring syphilis. Pregnant women have acquired syphilis, and in the last year since the pandemic, I counted there were 17 babies born dead because they had congenital syphilis in utero and were stillborn. Over 100 babies are born with syphilis every year in Georgia for the last several years. And to me, that is a crime because we are Georgia, we have some of the best health care available. That's why you all in the room helped us by increasing the testing for women during pregnancy. But we really recognize this has got to be a major push because mothers and babies should not be dying or suffering long-term consequences of syphilis. A good a colleague of mine in one of the district's public health nurse identified a woman in her 40s with syphilis in the eye that had made her blind. I mean, this is unheard of, and this is Georgia, and we're seeing this all over the country. Michigan reported something similar. But we know this. I've engaged MAG, the Medical Association of Georgia, to help us do training. We've engaged with other very active medical groups, pediatrician groups, to talk about the importance of doing this. And I'm talking too much, and I'm going to hurry. And the last thing is the capital projects. And saying that, this is not nearly as exciting as syphilis, but the governor recommended, and these are all generators that are literally at the end of their life, and generators are incredibly important for public health because of vaccines and other things we need to keep at a temperature. And so we hope you'll see the need for these very old facilities to have upgrade of these equipments, much needed. We learned the hard way last year, a year ago, when we had our lab freeze and we lost a lot of capacity. And so we don't want that to happen again, and particularly losing vaccinations. So having said that, I will also say that I have some handouts both on maternal mortality and some of the many things that have been done, because I think the narrative has been that nothing's been done. So much has been done. It's really quite remarkable, and yet more needs to be done, particularly in a system-wide approach, because there are individual level interventions in ensuring women have access to things like cardiology checks and other hypertension checks, but the system approach across physicians, hospitals, community groups, pediatricians, obstetricians. These are the things we're trying to create, a system-wide kind of full court press with public health to make this everybody's top priority right now, as well as syphilis prevention, which is my hope, our hope that we can do that. So we have these handouts for you, and I can also provide them for those of you who, if we don't have quite enough. And if any of you have more in-depth questions, we are happy to meet with you anytime in the next several days to weeks to further explain some of these issues and we are doing and get your ideas on what additional things can be done. I'm sorry I went over.
Thank you, Dr. Toomey. We have 2 questions. Chairman Watson. Hold on. All right, there you go.
Thank you, Mr. Chairman. Thank you, Dr. Toomey. Appreciate your presentation, especially the frankness related to the organization of the Department of Public Health, and also the Gavers update, making it easier for physicians to use, and the education that your department provided to help with that. My question relates to the money that we put in relating to GRITS, the GRIT system, the immunization registry. Where are we with that? Has that been done? Is that updated? I'm just out of my...
It's updated now. You should, I hope, have received an email about we're actually in the process now of making that interface with your electronic medical record. And that actually just went out, as well as to the districts. And so we were actually at the point where we're interfacing to be able to directly draw those vaccination records into GRITS to not have to re-enter it, because that's just, nobody wants to enter things twice, and that's the way the old system was. And this is trying to create that seamless interface.
Well, thank you. I appreciate that, because the one that was most successful is the interface relating to a prescription drug monitoring program. And that's literally one click away. It sure would be nice to get that for a GRITS and for one click away on your electronic health record. Thank you.
Representative Glaze.
Thank you, Dr. Toomey, for just a robust overview of what we are hearing and understanding from your research. I thank you also for bringing to the floor the maternal mortality in the state and how it's impacting us and what you guys are doing. Your report is just very, very helpful. I do want to ask if doulas would be a part of your system-wide approach of helping get advocates to the doors of these women who are needing help. And again, your data shows that Black women are almost 3 times affected by the mortality rate. So thank you for, again, getting that information to us, and help me understand if doula is going to be in that line of offense to help the women with advocacy.
Is that a question? Yeah. I mean, doulas, I think it depends on your definition of doula. To me, a doula is it helps the woman, helps her labor, even helps prepare her for what may be ahead. Even help, I think, you may not know, I trained, my OB training was in Ireland, and midwives served that role as a doula, making home visits and also working with a woman. And I think that is a great model. I'm not comfortable with doulas birthing at home, and we can talk about that afterwards. I had very bad outcomes in places where I practiced, and we can talk about that, but I'm so happy with the idea of doulas serving as coaches, support, helping to advocate for the woman, because I think it's difficult to navigate the healthcare system, particularly when you're pregnant, particularly when you're in labor and you're worried. And I strongly support that role and other roles for the doulas to play. Or some birth helper or community health worker. I mean, again, the devil's always in the details, isn't it, how you define it.
Thank you, Dr. Toomey. We appreciate all the work you and your agency do, and everything to keep us all publicly healthy. How about that? Thank you.
No, we're definitely publicly healthy, but I'm very sorry I went over.
That's fine. Thank you. We're catching up. Thank you. Hey, just get them to pass those out for you. So, yeah. Next up is Commissioner Patricia Ross with the Department of Veterans Services.
Hey, my friend.
us ready to get out of here. All right, y'all get in and out. Quit socializing, please. We got a tight train here. Y'all make room, please, in the back of the room. Let people get in and out. All right. Y'all please find a seat. Let's quiet down, please. Commissioner Ross, I believe this might be your first visit.
Yes, sir, it is.
Well, I'm sure you'll do great. We look forward to hearing from you, and the floor is yours.
Thank you, Chairman Hatchett. Thank you, Chairman Tillery, and members of the Joint Appropriations Committee. I have been drafted to the big leagues, so this is our first time presenting in front of this august body, and it is definitely my honor to be here today and to represent the almost 800,000 veterans here in the state of Georgia. And I am very grateful to be the commissioner for them and for you for the last 2 years. So our mission is not just to counsel our veterans on their earned benefits, both federal and state, but to walk them through one by one, hand in hand, to navigate the often complex process of getting benefits through the U.S. Department of Veterans Affairs. It is not only the application for benefits, understanding medical jargon and diagnostic codes, but we want to ensure that they get those earned benefits based on their active military service. However, our vision is working with others to empower both the veterans and their families to flourish here within the state of Georgia. So right out of the gate, I know a lot of our veterans get us confused with the U.S. Department of Veterans Affairs. As many of you know, they have 3 administrations: the VA Benefits Administration, the Cemetery Administration, and the Health Administration. We do have some touch points, which is what I'd like to go over. So for our field operations and appeals, that's where we engaged with the Veterans Benefits Administration. Ultimately, the VBA, the Veterans Benefits Administration, they make the decisions on all claims, whether it's disability, compensation, educational benefits, home loans. However, what our team does is they're the ones who help that veteran or their eligible family members apply for benefits. And we do so, again, by being trained to very high standards, legal standards. We're accredited by the VA to not only provide that counseling and help them initiate those claims, but we do through a system that goes directly into the VA. So their claim automatically shows up into the VA, and we help walk them through step by step, encouraging them to never give up. So for our National Cemetery Administration, where we have that direct interface, many of you know the National Cemetery in Canton. We have 2 here in the state of Georgia, in Glenville and in Milledgeville. They do provide some plot allowance funding for us to be able to insure our veterans and their eligible family members, typically their spouse or dependent children. But they also inspect us. So that is our main place where we overlap with the National Cemetery Administration. As far as VA Health Administration, I'm sure many of you who have gotten constituent complaints have probably gotten them on behalf of VA healthcare. We don't have any clinics, we don't have hospitals, we don't have physicians that work for us, nor do we care for our veterans in that capacity. That is solely the U.S. Department of Veterans Affairs. What we do have is our 2 veterans homes, our skilled nursing homes in Milledgeville and in Augusta, which care for our veterans, and we are also inspected by the VA. So moving on to, actually I think I skipped. Okay, there we go. So I said we had almost 700,000 veterans. This is an approximation through the VA. We do have 55 field service offices helping our veterans. We stand 9th in the nation for veteran population, but we're actually bringing in the 5th largest amount of compensation and pension into veterans' pockets, into their families, to the tune of $4.4 billion this last year. A year ago, it was $3.6 billion. So you see our younger veterans are actually having more needs and are being compensated at greater rates by the U.S. Department of Veterans Affairs. So for our 55 field offices, we've got a fairly limited staff, but we do support every county here in Georgia. We also provide support to, right now, 264 veterans receiving care in our long-term or skilled nursing facilities. We've interred almost 8,000 veterans and their spouses. All of this equates to about 41,000 claims we submitted this last year alone. Again, that's $4.4 billion is what that equated to. But we also have an appeals team that's located with the regional office in Atlanta. They did just over 100,000 actions. So when a veteran gets a decision that they would like to appeal to a veterans law judge, that then is taken by our appeal team, which is about a dozen people, and then is argued in front of that judge or the Board of Veterans Appeals. And that ended up with about $158 million more in compensation to our veterans. So our 2 war veterans homes, I know I may get questions on this. You can see we have an intergovernmental agreement with Augusta University that manages our Augusta home. Current patient load was 119 when I did those slides. I think we're 117 right now. Milledgeville, which we did have a change in contractors. We had to do an emergency contract over the summer. It is now run by STG International. Our current patient load is right now, was 145, we're at 143. As you can imagine, that varies day by day. But our home in Milledgeville actually has a VA clinic on site as part of that campus. We're undergoing renovations, and I do want to thank y'all for all the funding you've given us to bring those facilities up to standards, specifically ADA compliance. And thank you for your support for our veterans as they age. Okay, so now that you know a little bit more about what we do, let's go into the budget. And this is the full budget. I want to thank you all for the $1,000 increase to our state employees. We, like every other state agency, have struggled with attracting and retaining talent. The $1,000 this last year definitely helped that at the end of the year. So you can see that our changes in the budget are that increase in salaries. I broke out our programs, and I put 2 programs on this slide for a very specific reason. You see that we ended up gaining $1 million for a mental health grant. Last year in House Bill 414, we ended up what was originally projected for DBHDD came to us for a veteran mental health grant in the tune of $750,000, which we then subgranted out all of it. Our agency retains none of that funding to 2 organizations that are helping in the veteran and military mental health space, one of which was Emory University with their brain health clinic that treats everything from PTSD, traumatic brain injuries, as well as depression, anxiety, etc. They were able to bring on an additional outreach coordinator with that grant funding and have been doing tremendous work here in the state of Georgia. And then the majority of that funding went to an organization called the Cohen Clinic, or the Cohen Veteran Network in Hinesville. I know many of y'all have visited that clinic. They are doing tremendous work. They were able to bring on another clinician, some additional staff. They have had about 2,500 unique services they've provided this last year because of this additional funding. And in fact, December was their highest year highest month where they brought on 30 new patients. They're also expanding outreach into doing telehealth, not just in the Hinesville area, but throughout Georgia. So what happened is in the amended 24 budget, we had $1 million that had been sitting in our cemetery fund because we had submitted for a grant for a new veteran cemetery in Augusta. We were not awarded that grant by the VA, and so what has happened is that funding has shifted from our cemeteries to departmental administration, so we can then grant out that full $1 million through a competitive process. So that's a shifting of money. Again, none of it residing with our department. And then we had a reduction for a vacancy there within departmental administration, which was an admin position. So that kind of covers the 24 budget for those two programs. The next program are nursing homes. So you see, because we did have to short notice transition contractors, there were some upfront costs. The original contractor had been there about 27 years. And so this was not only to bring a team to ensure quality care to those patients, but to make sure that we retained the employees. And in addition, they had to purchase some equipment that had been owned by the prior contractor. So that's the $200,000 addition you see in the War Veterans Nursing Home. That is for Milledgeville, as well as the salary increase for the one position that falls under that program. I did add in our federal funding, so you can see we do get considerable federal funds. That is a matching per patient day cost based on the disability of the veteran that is then matched by state funds, as well as that other fund, which are patient fees that we charge. So, going to our last program, which is Veterans Benefits. That's where our field office personnel, our veteran service officers fall, as well as our appeals department. That ended up being the $1,000 increase was the only change in the amended budget. They do get some federal funds in this program. That $753,000, almost $754,000 funds our state approving agency, and that's the organization that goes out to institutions of higher education, accredited, non-accredited, on-the-job training employers. Anybody that is approved for VA education benefits, like the GI Bill, they have to certify them. And so that's fully funded through a grant with the VA, which is where those federal funds come in. This is the entire budget. You can see the puts and takes. This is everything just on one slide. I've already gone through all of this, so I won't. I know you can't even read that. So let's get into 25. Okay, 25, as you can imagine, we're like every other agency. We did have the COLA increase. Again, thank you for helping me to retain, again, this highly qualified and trained staff. They are definitely deserving of additional funding so we can retain them. And then we have, of course, the other adjustments through the Department of Administrative Services for insurance, Georgia Building Authority for our security and operations, technology, merit system increases, and then we also carry that one vacancy that we took funding from in the amended 24 into 25. The next program are cemeteries. Again, nothing different there. Except for the state-approved increases for the COLA, GTA, DOAS, et cetera. And then looking at our War Veteran Nursing Home, again, same thing, the COLA. Because Augusta University, of course, falls under the teacher's retirement system, you see that adjustment that's a little bit different, as well as healthcare insurance under the University System of Georgia. So that is for our Augusta home. Again, showing you our federal funds and our other funds that are carried through, same amount we're projecting from 24 to 25. And then our veterans benefits. So this is probably the biggest change in my department. We have all of the statewide adjustments, but we also have one addition as well as one subtraction. So, in fact, I thought I saw Senator Walker in here. Central Georgia actually is filing more claims than any other region here in the state. And we know that there is a VA mega clinic being built in Perry. Where possible, we co-locate with the VA. One, because it is better for the veteran. They come to get their health care appointments. They can come see us, provide us paperwork. We can help them with their claim. It's also of no cost to the state. So we're provided actual office space, no cost to the state government. So Houston County, which is getting ready to open that clinic in Perry this summer, has put aside 2 offices for us to have 2 veteran service officers, again, to help folks with their claims. And so that total cost, along with some laptops, et cetera, was about $135,000. But then we ended up taking an additional cost, 2 positions coming out of our appeals directorate, as well as some efficiencies we'll have to find in our training and travel budget. Ultimately, if you net it out between the position we took in admin, the 2 positions we'll take in appeals, that ends up equaling the addition we'll get for those 2 positions for the Perry or the Houston County Clinic. So that's the biggest change in our budget for '25. You also see the same federal funds for our state approving agency or the education and training department. This is everything again in a snapshot, a little bit longer with all of the state adjustments. So that's over 2 slides. And then I look forward to your questions.
You do have some. Wow.
Uh-oh.
We were getting ahead.
Now,
Chairman
they're not
Burns.
allowed to go longer than I did, right?
Chairman Max Burns.
Thank you, Mr. Chairman. Thank you for your presentation and the input and the support that you provide for our veterans in Georgia, which I are one. I want to discuss the transfer of the $1 million from the Augusta Cemetery to mental health services. Certainly support mental health services and acknowledge that we've had a hard time working with the VA, the federal VA, in gaining support for that project. Got great support in Augusta. Got great support in the community. Have a distinct need. And what I'd like to know is how would your agency be willing to work with the community in promoting that project as we move forward?
So we've been working with that community over the last 4 years and have gotten that $1 million to be able to apply for that federal VA grant for cemetery construction. I don't know, I probably should have pointed it out in our baseline in '25. That $1 million reverts back to the cemetery, so it's there again for us to apply for that VA grant. So we will continue to support the community in applying for the VA grant for that cemetery. I will tell you, it's a challenge, mainly because over the last 3 years we've submitted for that grant. The Augusta Cemetery keeps going lower and lower on the VA's priority list based on overall federal funding. So that will be a challenge, sir, and thank you for your service.
We acknowledge the challenge. We just ask that you join the fight. Thank you.
Yes, sir.
Is that Chairman Bonner or, go ahead, all right, I'm sorry. Go ahead. Gamble, I'm sorry. Representative Gamble.
Thank you, Chairman. There was a recent article published that the Department of Veterans Affairs website about veteran homelessness and the population increases nationwide. And so I was just curious, do we know what the number is here in Georgia? And what are we doing to identify or address that need?
Thank you for that, and that's an excellent question. So veteran homelessness is increasing, as is overall homelessness in the nation. We don't have a count. I will tell you the PIT count is scheduled for the last week of this month, the point-in-time count, which we will partner with other organizations to go out and try and capture the amount of homelessness we have. We do know about 25% of our homelessness have served in the military. It is a growing need. We do our best. We have an outreach team that is jointly staffed by our military and minority veterans outreach coordinator, as well as our suicide prevention and outreach coordinator, because as you can imagine, those that are at risk for suicide or mental and behavioral health and have issues there, as well as our marginalized population, tend to make up the majority of our homeless population. So between the two of those, we're actually going out and partnering with those organizations that help with homelessness. In addition, through a state grant, we have a system that is throughout Georgia called Unite Georgia, where we have partnered with community agencies and other nonprofits so that if somebody comes into one of our offices, or the Technical College and Workforce Board, because they're our partners in this as well, we can submit their information in that system and get them connected right away with a housing provider. I will tell you, it's still probably not enough. Homelessness tends to be rampant, especially now. But we are diligently trying to tackle that problem. So thank you for that.
Chairman Payne.
Thank you, Mr. Chairman. Thank you, Commissioner, and appreciate all that you do. As we've funded a subacute care unit multiple times, I was just curious as when that might be implemented.
We've not funded it several times. It was 2 appropriations that took, of course, a couple of years to fund it. We were scheduled to open it last summer, but with the change in contractors, I'll be just upfront with you, the change in contractors at the Milledgeville home, we had started that process. We had to let an emergency contract mainly for financial reasons. We have a new contractor in place that is kind of ensuring that that population that we're currently serving is cared for, but they have said they are committed to opening that facility. And so we're, fingers crossed, I hate to overpromise and underdeliver. We're looking at this next summer now that they will be in place for about a year. So that is still high on our agenda to open, because it will do great things for our veterans here in Georgia. So thank you for that, sir, and thank you for your service as well.
Chair Lady Mathiak.
Thank you very much. I come from Spalding County, and the number that I'm getting is 132 homeless veterans in Spalding County that are not receiving services because most of them are homeless. They do not have an address. That being said, we also have a clinic in Zebulon, which is Pike County, that is not being, there's not enough doctors, nurses, support staff there to serve our community, and I'm very disappointed in that. I've been helping a World War II veteran female that's 101 years old, and it has been a nightmare. The software, is that coming through the state or is that federal? We need help in that tremendously. I totally understand the frustration of our veterans.
As do I, and thank you for that. And thank you for helping that World War II veteran. That is, of course, a population that definitely deserves all of the assistance we can get. We do have a position in Pike County in the Zebulon Clinic to help with veterans benefits. We would also be willing to help her. I will tell you, intentional or not, the VA does make the system very difficult to navigate, and they're pushing more people to the website to apply on their own. We, as well as 49 other states and 5 territories, have organizations like mine to help those veterans. Just this week, our constituent request we've gotten on the benefit side, not necessarily the health care side, have been because the individual has tried to do this themselves and they failed and are now in this endless loop of denial with the VA. Please call our offices. That is why we exist. We are, again, trained, we're certified with 6 different agencies to do this on behalf of our veterans. So thank you.
I appreciate that, because we have our congressman who has been very helpful. But again, I'm talking months. This lady's 101 years old. It's out of control. It's out of control.
Yes, ma'am.
Chair Lady Kirkpatrick.
Thank you, Mr. Chair, and thank you, Commissioner, for moving the Department of Veteran Services into a broader vision. It's been a breath of fresh air working with you, so thank you for that.
Thank you.
We had a study committee in the Senate on the VA nursing homes 2 years ago, I believe, and we identified that Georgia is underserved compared to our surrounding states. We only have 2 nursing homes. Some states around us have 5. And we recommended a long-term plan for addressing that, but I've lost track of that. So I wonder if you could update me on where we are with that.
Yes, ma'am. So we did, as you know, with the study committee, we conducted a research study through Kennesaw State University that has the Advancement for Military Emergency Services Research Center. They did a study that in the short term identified a need in North Georgia and in South Georgia. So Augusta, of course, has a population that it supports. Milledgeville has a population that it supports, but of course that leaves many areas of our state not cared for by a long-term skilled nursing home for our veterans. So North Georgia, South Georgia were identified. Unfortunately, in the governor's recommended budget, the first home that we had found property for through state properties and with an agreement with the technical college system is not funded. There's a significant cost, I will tell you that. Construction costs are borne by both the state and the federal government, so it's a 65% split where the VA pays for 65%, but that 35% is still significant, and it's not in the budget.
Chairman Harbison.
Thank you, Mr. Chairman. Commissioner, let me first of all commend you and congratulate you for your recent induction into the Georgia Military Veterans Hall of Fame for the work you do for veterans. So I thank you for that. But my question is regarding the Returning Veterans Task Force. Is that still in progress, or is it still working, and how is that coordinating between the active duty soldiers and the veterans that you set up earlier?
Yeah, thank you for that question, sir, and thank you for your accolades as a fellow Hall of Fame member. Congratulations to you too. So the Returning Veterans Task Force, we meet quarterly. In fact, we met last week, so it's still an ongoing initiative, and for those of you not familiar with it, what we do is we bring not only state agencies to support our veterans together, but we bring community partners, the university system, technical college system, to better serve those individuals coming out of the service. We've made some changes, I know one of which impacts your area, sir. So we're trying to also get on our active duty military installations. Our two biggest ones here in the state are Fort Moore, where we have an individual co-located with the transition team on the active duty installation to be able to capture those soldiers before they transition out. And then we also have an individual that serves on Fort Stewart in their transition program. So there also are inroads to the transition programs, and we have the transition managers also join us at our Returning Veteran Task Force meetings. But yes, sir, it's still very, very valuable and very vital, and we look forward to meeting every quarterly to advance the needs of our veterans and our transitioning military. So thank you.
Thank you, Commissioner.
Representative Williams.
Thank you, Mr. Chairman. Thank you, Commissioner, I'm over this side. Hey there. That for all you do. Thank you so much. But I want to follow up on any question to get some clarification. We only have 2 nursing home facilities, and with surrounding states, I don't understand. Have we done a study to determine how many beds are needed additionally? I represent a county that has the highest percentage of veterans and active duties in the state, and I know the need is there. And the Cohen Clinic in Hinesville was privately funded by Mr. Cohen, who owns the New York Mets, and the land was given by a local landowner. It's a great help. But I need to know, what's the need? Have you done an assessment of the need for additional beds? And when you do this assessment, please consider my dear friend and senator and advocate from Southwest Georgia. Give her a home, if any way possible. Senator.
Did you ask a question finally?
I did.
Okay, or did you answer it too?
No, I just asked for a home, but I did. I still want to know the assessment. That's the question.
So you can see if both of our homes were at capacity, we would have about 450 beds or so. Capacity is driven based on appropriations, so we could add more patients if we had additional funding, because it is a state/patient fee and federal match. Our surrounding states I'm going to Alabama next week to see their newest veterans home. South Carolina is getting 2 new homes. They have 5 and 6 homes apiece in those states, but half our veteran population. I will tell you, through nobody's fault here in this room, my predecessors did not see veterans homes as a priority for this department, and I certainly do, because we are seeing younger veterans with greater needs needing that long-term care. And I know the General Assembly and y'all here in this room have given us the funding for that subacute unit. We are excited about opening that up. That is in Central Georgia, and we know there are needs elsewhere. That study not only identifies short-term needs in North and South Georgia, but also in the metro area, as well as our largest populations, quite honestly, are outside of our military installations. And we've been targeting those not necessarily for skilled nursing care, but for some of our mental and behavioral health and suicide prevention efforts. So thank you for bringing that up, sir.
Commissioner, last question, Representative Oliver.
Wellstar takeover of the Augusta Medical Complex, did they take over in what way, or what's the impact on the nursing home there?
So, ma'am, thank you for that question. We've had no impact. So operations have continued as they did under Augusta University. We have not seen a change in patient care and patient staffing, any of that. So Wellstar taking that over has not impacted the care to our veteran patients.
Following up on your capacity issues, as I look at your numbers, they look to be over a third down than they were 5 years ago. And as you look at the other states' use of nursing homes more extensively, I'm curious if part of your analysis is that they accept Medicaid, which Georgia nursing homes do not accept Medicaid. How does that work? And you can get back to me on that, because it's been an ongoing issue about how we fund these nursing homes with what streams of money.
Yes, ma'am. And we are looking into that. I will tell you, as you said, we don't accept Medicaid. Alabama does not either, as well as Mississippi, but there are other states around us that do and have different funding models. And I've been in dialogues with all my state counterparts here in the Southeast, as well as trying to learn more about the different funding streams to see how we can fix this issue.
Thank you.
You're welcome.
Thank you, Commissioner.
Thank
Thanks
you,
for
sir.
serving the important population of our state. Thank you. Next up is Commissioner Rebecca Sullivan of the Department of Administrative Services.
Do I just drop it in the right order?
You can just do it from here if you want.
Okay.
And then you can just take it out later.
Okay, just drop it on the desktop.
Yeah.
There we go. And so yeah, we DOAS,
So is that
Oh no, you can go here. So you can use DOAS SAO. It's just after SAO, which is possible.
All right.
Commissioner Sullivan, prior to you getting in the podium, I know you're a very thorough and detail-oriented person. All this being said, that you and our next presenter are between us and Mary Max. So I know I haven't looked at your presentation, but if there are ways that you think you may be able to abbreviate, but I know you got important things to discuss. I hate to do this, but just saying that. So thank you, and the floor is yours.
Understood. I'll try to make it quick. Good morning. Rebecca Sullivan. I'm honored to serve as the Commissioner of the Department of Administrative Services. I am pleased to be here today to share information about some of the services that DOAS provides to support state government and speak to funding that Governor Kemp has recommended for DOAS to continue our work. Thank you for your time today and the invitation to address you. I would like to acknowledge several of my colleagues who have joined us today who help lead our department. Paulette Petty, our Chief Financial Officer, Christine Green, our Deputy Commissioner of Operations, Wade Damron, who is our Director of Risk Management Services Division, as well as Dan Regenstein, who's here, who serves as our Chief of Staff. This morning I will address recommended funding for the workers' comp, liability, and property programs within our Risk Management Services Division. Additionally, I will address the increased assessment revenue for the DOAS Human Resources Administration Division and close with a few positive updates regarding our state's workforce. But before diving into risk management, I would like to mention our appreciation to Governor Kemp and you all for the recommendation to add $77,000 for the one-time $1,000 supplement for recruitment and retention. So jumping right in, I guess I should have jumped in there first, but well, I'll go through each one of these changes in order in the presentation. Among our many responsibilities, DOAS ensures the state workers' comp program. This program provides workers' comp coverage for about 132,000 employees that receive about $8 billion in annual payroll. DOAS self-insures each workers' comp claim up to $5 million, and we carry a commercial policy to provide coverage for any claim exceeding that amount. As you can see, I don't know if I can make this can I make this a full picture? As you can see illustrated on the graph on this slide, the state's outstanding liability for workers' comp claims has grown steadily for years, reaching a peak of $776 million in FY21. However, I am happy to report that we are starting to see this program move in the right direction. In the amended FY22 Appropriations Act, you may remember the Governor and General Assembly appropriated $150 million to the workers' comp program, which allowed risk management services to settle 686 outstanding claims, resulting in a $168 million, that is a 22% year-over-year reduction in outstanding liability in this program. So thank you for supporting us in that and entrusting us with those funds. While this reduction is very positive news, we do believe there's an opportunity for further investment in this program. There are currently over 3,200 open claims in this program, and about 3,500 new claims are filed every year. So we'll provide this presentation if you're not able to see the full graph there. So the recommended appropriation of $125 million in the amended FY24 budget would allow us to settle hundreds more claims, resulting in further reduction in the state's outstanding liability in this program. And the cost avoidance gained from resolving these claims will permit RMS to continue to settle claims where possible. So DOAS fully supports the state's investment in this program, which we believe will continue to show a positive return on investment for the state. DOAS also administers a liability insurance program that provides financial protection to state entities and employees for bodily injury and property damage claims filed against them for actions taken in the course and scope of their employment. Thank you, David. This includes both state tort claims as well as federal claims for which the state's potential liability is generally not capped. The liability program insures 325 state entities and 132,000 state officers and employees. We self-insure the first $5 million of each claim and carry excess commercial coverage for claims that exceed that amount. We currently have 2,200 open liability claim files, and approximately 2,600 new claims are filed every year. You will see from the graph on this slide that the state's outstanding liability for these claims has been steadily increasing from FY 2016 to the present. The outstanding liability has increased from approximately $89 million to $370 million in just 7 years, which is an increase of 316%, or $281 million. Without additional funding, the liability program is projecting a $41 million deficit by the end of FY26, as well as continued growth in the outstanding liability. We have been studying the historical increase in claim costs and outstanding liability in this program, and the reasons for this growth are nuanced. But notably, for several years, claim costs have depleted the trust fund each year, and it has been necessary to push program liabilities into future years. Through RMS's comprehensive loss control program, we'll continue to assist state agencies to address the risk and exposures that they are facing. In fact, as part of our agency's strategic plan, this year, one of our objectives is to expand our loss control efforts as we work to address increases in claim costs. The governor has recommended $75 million for the liability program in the amended, and to increase billings for this coverage by $13.3 million in FY25 to reflect claims expenses. This funding is necessary to maintain a positive balance in the liability trust fund, allowing risk management services to annually satisfy the state's legal obligations and to give us the flexibility to efficiently manage and defend liability claims against the state and its officers and employees. So we fully support the governor's recommendation to invest in this program as well. Turning quickly to property, DOES also insures the state buildings and contents. Almost 14,000 buildings with a total value, including contents, of almost $50 billion. The map on this slide shows the locations of the buildings we insure and the number of state buildings in each county. We insure the state's buildings and contents through a combination of self-insurance and commercial carriers. The first $10 million of each claim of each occurrence is self-insured, with commercial carriers providing excess coverage for a total limit of $1 billion in coverage. The cost of this excess coverage is approximately $40 million for the current fiscal year. Governor Kemp has recommended a one-time appropriation of $50 million in the amended FY24, which is necessary to address rising costs in the property program and ensure adequate protection of the state's property. This slide shows the historical financial trend of the state's property program trust fund as impacted by program costs and premium billings. The blue line represents the premium billings to state entities over the last 14 years, which have remained relatively flat until FY24. The black line represents program costs, which have been increasing since FY19, resulting in a projected deficit in the property trust fund balance, which is reflected by the orange line. Without the $50 million in state funding, RMS is projecting a deficit in this program of $18 million by the end of FY26. The increased costs of the property program, I wanted to point out, are not an issue specific to Georgia. The national and global commercial property insurance market has been challenged for many years due to a number of factors that have led to substantial underwriting losses and unprofitable returns for property insurers and reinsurers. So the state's property insurance program has also been impacted by these challenges to the industry. And in recent years, we have seen significant increases in the cost of commercial excess coverage. Additionally, the self-retention or deductible per occurrence in the property program increased from $1 million to $10 million in FY24, which means that the trust fund will be more heavily impacted by large property loss claims caused by significant weather events. So to ensure adequate protection of the state's property, DOES fully supports the governor's recommendation of $50 million in one-time funding to the property program and amended FY24. This appropriation will stabilize the property program trust fund balance and also allow us to address future significant claims. Moving on, much of DOES's responsibility relates to the management of the state's physical assets, procuring them, insuring them, and disposing of them when the time comes. But our responsibility also extends to the area of human capital, which is, of course, the state's most critical asset, state employees. DOES Human Resources Administration Division, which I'll call HRA to save time, their mission is to create enterprise-wide human resources programs to provide agencies with the necessary resources and tools to attract, develop, and retain a high-performing workforce. The services we provide support all stages of the employee life cycle, attraction, recruitment, onboarding, development, retention, as well as separation. The HRA division is primarily funded through merit assessments to state agencies, which you've seen each agency present those statewide changes, which is calculated based on a percentage of employees' salaries. The governor has recommended an increase in the merit assessment in FY25 in the amount of $884,000 to address increasing operational costs. We fully support this recommendation, which will allow HRA to continue to provide these enterprise HR services at our current level. As state employees are the backbone of state government and our most important asset, it is imperative that the state continually focus on the state's workforce, and HRA serves to support these efforts. With regard to recruitment to state government, HRA continues to focus on building partnerships between state agencies and educational institutions, which help build career pipelines into state government. And we are studying attrition and retention. HRA conducted an engagement survey of state employees last year. Over 12,000 state employees from 62 agencies responded to this survey. As part of that survey, employees were asked to rank a number of factors that would contribute to a decision to stay in state employment. Those results indicated that the primary reasons for staying are positive work-life balance, performing work that matches interests and strengths, as well as state benefits. And conversely, the survey results indicated that the primary motivators of why employees may leave state government relate to compensation, career opportunities, and life-work balance. We've shared this data and findings of the retention study with state agencies and the human resources community, and we will continue to support them in their retention efforts. In closing, I'd like to share some positive news about the state's workforce that have developed since I was here last year. This slide shows some key highlights from HRA's 2023 FY 2023 workforce report, which is published on our website. In FY23, the voluntary turnover rate decreased by 4.2% compared to the previous fiscal year. This represents the most significant year-over-year improvement since at least FY 2011. Last year, I spoke about the hole in the bucket of the state's workforce. The rate of separations exceeded our rate of hires for many years. I'm very happy to drop that analogy from my presentation this year. The number of active full-time employees in budgeted established positions increased by 3.5% from FY22 to FY23 as our hires finally exceeded our separations. This is only the second such increase in 15 years. I'll also note that due to recent appropriations, thank you all, related to personal services, average annual compensation of state employees increased by 7.7%, while the median annual compensation rose by 5.4%. While this is all great news, I'll stress that the turnover rate is an average, and there continues to be more work to be done to support the state's workforce, and we will continue in those efforts. In closing, I just want to say that I appreciate the opportunity to be here to share with you today. I also appreciate the confidence that you all have shown in DOAS. Our partnerships with the General Assembly, as well as across the executive branch, are essential for us to be able to fulfill our vision to be a customer-focused and collaborative partner that promotes responsible fiscal stewardship. So we're grateful for your support. Mr. Chairman, I'm happy to address any questions you or any members of the committee may have.
Breathe. That was very fast.
Okay, I'll sit down. Thank you.
Well, actually, no one has a question. Going once. There we go. Representative Holcomb.
Thank you, Mr. Chairman. Commissioner, I heard you say that the increase of 316% in one of your earlier slides was nuanced, but can you give us a little more nuance in terms of what's driving that? That's an outstanding rate of increase.
It is an outstanding rate of increase. And you're referencing to the liability program. I'll ask our Director of Risk Management, Wade Dameron, to step up and address that question. Go ahead, Wade.
Thank you for the question. Thank you for the opportunity to be here today. It is somewhat nuanced, but when we break down state agencies and place them in industrial classification type codes or sector codes, we see that there are about 6 sectors that make up about 88% of the claims for the past 10 years. And so from our loss control standpoint, we've worked very hard with our comprehensive loss control program to really look at those sectors. And within those sectors, we find that there are about 3 cause codes that affect our auto liability program. There are about 6 specific cause codes that impact our federal cases, which we call broad form cases. And then finally, on the tort negligence side, there are about 6 cause codes that across those agencies we see the majority of the cases. So we've been really working hard to pinpoint those, do education, and make sure that agencies understand the claims that they've had and have the programs and resources available from a risk management, safety, loss prevention standpoint to address those going forward. And so we're happy to share additional data around all that with the committee at any point in time as well. Yes, sir.
I think you've exhausted the questions. Thank y'all for being here. And I think next is Ms. Hines.
Next up is Geralda Hines from the State Accounting Office.
I bet we're going to hear something about the most expensive program, an exciting program.
Not the most expensive.
What might that be called, Chairman
It
Tiller?
sounds to me like a next generational item.
Well, before we get to that, and I know I'm in between you and Mary Mack, so I'm going to go as fast as Commissioner Sullivan did. First, I want to talk about, good morning first. Can you hear me? Oh, here we go. Well, good morning again, Chairman Hatchett, Chairman Tillery, and members of the committee. My name is Geralda Hines, and I'm the State Accounting Officer. I want to talk about the amended FY24 budget and the FY24 Governor's budget recommendations for your consideration on page 85 and 86 of your budget book. The State Accounting Office is responsible for the annual comprehensive financial report and audited financial statements for the entire state. We also provide payroll and accounting shared services for both fiscal savings and process efficiencies for 27 agencies. In addition, we are responsible for the operating and maintaining of the State Enterprise Resource Planning System, TeamWorks, which I will be talking about the replacement shortly. This system serves as a source of record for most of the state's HR and financial transactions. The budget recommendations for amended FY24, we have statewide changes that are in everyone's budget, but I do want to thank the governor for the $1,000 supplement and the recommendation for the 4% COLA, which goes a long way with retention of our workforce. On page 85, under statewide accounting and reporting, item number 2 is an increase in funds for the consolidation of data collection used to develop our AFR in the amount of $560,000. The request is for SAO to consolidate the Oracle Financial Consolidation Closed Cloud System to Workiva WDesk and from EasyLease to Workiva Lease System. Both migrations will go to the one Workiva platform, which will be a lot more efficient when we start integrating with the Workday ERP system. Also, both systems are used for the AFR reporting to consolidate data from TeamWorks agencies and agencies that are not on the TeamWorks system. The consolidation prepares, again, for us for the NextGen project and conversion and avoids delays in preparing that report. For FY25, on page 86, under Financial Systems and Statewide Accounting Reporting, there are 2 yes items, items 2 and 3, which is a transfer from one program to another of $247,000. This is for 2 internal control positions. These positions will allow SAO to monitor audit findings, internal controls, and guide agencies in the practice of appropriate accounting and methodologies. Providing this guidance and for timely and accurate accounting ahead of the AFRA preparation will ensure the state meets its deadlines and decrease the audit findings. These individuals will identify and guide agencies on basic as well as complex accounting tasks such as bank reconciliations, ensuring clearing accounts are balanced, accurately completing their year-end forms. Not having accurate, timely accounting practice can increase the risk for fraud activities and increase the audit findings, which ultimately can impact the state's bond ratings and the ability to receive federal funding. All of this, of course, allows for a review of the agency data, again, for the next-gen ERP system, which I'll be talking about shortly. Thank you for your consideration, and I can answer any questions you have before I move to the next presentation.
I don't see any questions at this time, so go ahead.
So next, and real quickly, Commissioner Sullivan and I are here to discuss the Next Gen project. We are excited how the project is going and want to provide you with an update as we're in the implementation stage of the project and entering the discovery and design phase of the project. Again, the accounting office is responsible for maintaining and operating the teamwork system, which is our current financial, human capital, and procurement enterprise system, SAO. SAO is in partnership with Department of Administrative Services in implementing the state's next enterprise resource planning system, Workday. The project is an enterprise-wide digital business transformation effort to move us from our 25-plus year PeopleSoft highly customized environment to a modern cloud-based software solution that will allow us to streamline and standardize our process across the state agencies. You will hear shortly a little bit more about how we have 200 agencies and entities using one or more of the business suites, and the Next Gen project has over 200 resources from various agencies participating to ensure that we meet their needs. We're leveraging technology that will be adaptable to the modern workforce and accessible from many devices, and we want to provide an end-user-friendly interface for quicker views and analysis along with more efficient, streamlined processes that will offer more real-time data.
This is another excellent example of how DOAS, how agencies can work collaboratively together. DOAS and SAO have been working to lead this project hand in hand for some time now. We have actually already completed the first two phases of this project, which included the procurement and selection of Workday, the Workday platform to replace TeamWorks, as well as the implementation partner for this project, which is Deloitte. We have engaged more than 200 employees representing 37 different agencies in mapping and standardizing our business processes for finance, human resources, and procurement to be ready for phase two. We have just kicked off phase two, which is implementation of this project. This phase includes discovery and design of the system, data cleanup and conversion, configuration, testing, and training. The final phase of this project will be optimization. After go live of the system, we will refine our processes and deploy additional functionality if it's needed. I've shared at a very high level the phases of this work, but to give you perspective on the scope, I will show you some highlights of the complexity on the next slide. The new platform consists of 3 business suites: finance, human capital management, and procurement, that will have to be designed and configured to meet the needs of the Georgia administrative support teams and Georgia employees. When we say human capital management, what we mean are such functions as compensation and payroll, recruiting, talent optimization, and time tracking. For finance, that's accounts receivable and accounts payable, budget, banking, grants management, and general ledger. For procurement, that includes requisitions and purchase orders, supplier management, and P-card transactions. So this is not going to be a lift and shift from the current system, but a true transformation in the way how we operate and an opportunity to make our business processes more efficient through new technology. There are over 200 processes that will need to be considered, over 100 interfaces with other systems, over 200 affected agencies, and thousands of vendors, banks, and more than 70,000 employees that will be affected by and become involved in aspects of this work. So although the state has contracted with a system implementer, this project cannot be done without the assistance of dozens of agencies and hundreds of state employees. In fact, our contract requires this level of involvement by the state, and our participation, the state's participation in the implementation will reduce the overall cost of this project. These employees will play a crucial role in the implementation of Workday as well as in the operation of the system in the future. So in order to retain these employees throughout the life of the project, we are proposing as part of our budget request to provide the project resources a pay supplement conditioned upon the total number of hours of work during this project. This project is on a very tight timeline, just much like our presentation, and Officer Hines will share that timeline with you next.
We're moving pretty quickly. Okay, so we have two waves with the project. The first wave is the Human Capital Management Suite, which includes 12 work streams, including benefits and payroll, which started January 8th of this year, and we have a go-live date of April 1st of 2025. The second wave, Financial, which includes procurement, encompasses 17 work streams, and it also started in January, and we have an anticipated go-live of October 1st of 2025. So the governor's recommendation reflects additional funding that can be found under Department of Administrative Services, Georgia Technology, on page 93 of your budget book. Director Thomas discussed the $158.5 million yesterday, which included $58 million of additional funding for the Next Gen project. These funds will cover such items as software platform costs for the implementation, the implementer costs with Deloitte to design, configure, test, and train, and also post-live support, data conversion costs and integration expenses, all to support our 200 and some agencies, 1,300 banks, 100 system integrations. Also, we want to acknowledge and thank our agency heads, the governor and the General Assembly, for the initial funding of this project because it goes a long way for our success. Thank you, and we can answer any questions that you may have at this time.
I don't see any questions. Is that it?
That's it.
Well, I want to say, y'all, this to the members while I'm loud. This is a huge undertaking. And I know it's going to change, it will change the way our state operates and become much more efficient, I believe. And I want to thank the two of you and others that are always with you when we meet with you. They are very conscious and deliberate about communicating with us about the progress and where they are, because it is a lot of money and it is going to have a huge impact on our state. And so thank you for what y'all do. I know you beat your heads against the wall sometime, but keep doing it and stay with us until it's done. So thank you very much.
Thank you, and thank you for all your support.
I was just going to echo that I can't tell you how many times y'all have met with us already. Thank you.
Y'all, we have been notified by the Rural Caucus that we were invited to have lunch with them in room 216. It is being provided by the Coastal Plains RESA. They're sponsoring lunch. So it's in room 216. You're welcome to go. And we will be back at 1. The meeting is with Commissioner Pat Wilson of the Department of Economic Development. He will be Zooming from Davos. His name Josh. It's not Joshua Kyle.